The cranial cervical healthcare is an effective, scientifically proven procedure in the cranial cervical junction profession. Its purpose is to restore the body's ability to heal itself and maintain optimal health. This procedure corrects head and neck misalignment and removes interference at the point where the head and neck join to reactivate body to brain communication so the body's natural self-healing process can begin. Brain health and healing messages leave the brain by the way of the brainstem, pass through the neck, down the spinal cord, and over the entire nerve system to all parts of the body. These messages control, monitor, and maintain everything that goes on in the body. They also direct healing. More than 100 different health problems have responded to this unique, precise approach, yet it remains practically unknown by the general public. So thank you guys for joining us today. My name is Dr. Phillips. I'm a cranial-cervical junction doctor. And today we have a very special guest on our show. Her name is Betsy. And Betsy is currently a freelance writer for natural health websites and other writings. She grew up in a house in the North Woods of Minnesota. She double majored in business communication and church music. She graduated summa cum laude, which means the highest honors, from Concordia University, Mequon, Wisconsin. She's someone I've known. She's came into the office back in 2008, and someone I know just to be an all-around fun human being. And we're just so excited to have her on our show. She's going to share her healing journey and how she got healthy. So without further ado, please let me introduce my friend, Betsy. Hi,
Hello.
Betsy.
Hi. Thanks for
Welcome
that
to the show.
introduction. Thank you. Glad to be here.
Great. Wow. Well, that was quite a background that you have. Thanks for spending a little time with us today.
Yeah.
Let's get right into it.
Okay.
You came to our clinic at the time. It was in Bloomington, Minnesota, and I'm looking at the date. Looks like it was October 31st, 2008. Does that ring a bell?
Oh, absolutely. Yep.
Okay.
I remember doing the research to find you online on UPC Spine.
Okay. Great.
Yep.
That's wonderful. So what I would like to start off with doing a clinical comparative comprehensive case history, comparing when you first came in back in 2008 to how you are now. So let's start off with the first thing that you came back in with in 2008. And by the way, I have about 28 things that were not functioning right, depending on how you divide them up. So we kind of have a lot of stuff to cover, but I think this is the best way to people to kind of get your story and get it out there. So the first thing that you came in was a pinched nerve in the neck on the right side. What % improvement would you give that since 2008? Overall improvement. The pinched nerve in the cervical spine.
Oh, wow. I didn't even realize I had it back then too. So that's interesting.
Yeah, probably because you're summa cum laude and you have a good memory. I misspoke. So I apologize. So you haven't been in for actually about a year and a half.
Right. Yeah.
And so let's start off with you coming back into the clinic on April 20th, 2021.
Yes. Okay.
And you presented with a pinched nerve in your cervical spine on the right. So what % improvement, if any, would you give it between April 20th to today, which is the 25th? So 5 days ago, you came in.
It's quite a lot better. I'd say, let's say 40% better,
Okay,
possibly
about
50.
40 to
Yeah,
50%
yeah,
improvement overall. Fair enough.
yes,
That's
yes.
in the intensity of the pain.
Um, yeah, intensity and maybe frequency. I
Okay.
would say overall, uh, there's not as much of that the weakness, and I feel like there's more mobility, and I'm able to lie down on my shoulder without having to prop it up with pillows, and so that's helping me to sleep better.
Oh, great. That's great. Sleeping better. That's sleeping is kind of an important thing, right?
Yes, yes.
Yeah. Okay. And that was number one. Number two is you kind of alluded to it. The pain in the right shoulder, in the right forearm, in the right middle fingers that had been flaring for about 6 weeks. What percent overall improvement would you give that?
Uh, Especially today, it's like maybe 60% better.
Okay, but maybe
Um,
average it out over the last 3 days. What would you give it overall
uh,
improvement?
we'll just go with like 40 to 50 again.
Okay, 40 to 50% improvement.
Yeah.
All right, we can handle that. Down the right upper extremity. And Owen, by the way, you had mentioned that you had been under NUCA care, which is an excellent form of upper cervical work in the cranial cervical junction in Duluth and in Madison, Wisconsin. Is that fair to say?
Uh, Not in Madison, just
Okay, not in
in
Madison. Okay, all right.
yeah.
But you were in Duluth, and then you also mentioned that you were in the Gonstead Clinic in Mount Horeb, Wisconsin.
Mhm.
Okay, before coming into our clinic. And what would you say were the results of those experiences?
Um, they helped a little bit and only for a couple days, and then it went right back um, to where it was. The Nuka helped a little bit more,
Okay,
especially with the pinched nerve.
okay,
So anyway, that's why I I came to the Twin Cities because it just wasn't getting better.
okay. Now, for all the viewers, there's some people out there, NUCA doctors probably listening to this, which of all the upper cervical, the cranial cervical junction techniques, I actually I actually don't do NUCA, but I put NUCA, I have the greatest respect for NUCA. So, but you've only had this type of care we're providing in Minnesota for 5 days, and you say you're about 40 to 50% better. Was NUCA better results than you're getting here?
Oh no, no,
So
it
you
was
would
not
say the
working.
NUCA was minimal to mild improvement, but then it came back within a few days.
Yeah,
Okay.
I couldn't tell. It didn't seem like it was lasting in
Okay.
that case. And it
Yeah.
has helped me before, but just not in this case.
Okay. And sometimes some techniques work for different people better than others. That's why there's other techniques out there. And
Mhm.
so I really like NUCA. It saved my brother from lower back surgery when he had a surgical date set and a numbness down his legs. And he had super bad, intense low back pain. And he got the cranial cervical junction area corrected, and 5 months later, he was 85% better and never did get the surgery. So I love NUCA, and I love Dr. Carrie Johnson in Apple Valley, Minnesota, for performing the cranial cervical junction healthcare that saved my brother from surgery. Now, 30 years later, 5'2" and 250 pounds, my little brother doesn't suffer from chronic low back pain or sciatica, and his schizophrenia was improved with the cranial cervical junction procedures. I mean, it kind of makes sense. Your head and neck is in improved alignment, and your mental health condition maybe isn't cured, usually isn't, but perhaps it could be improved on. And that was my brother Dan's case. Praise God. Well, that's very interesting. And then you also went to the world famous Gonstead Clinic. That's awesome. There's a lot of awesome Gonstead chiropractors out there listening and that do the Gonstead technique. And it's just a fantastic technique, just wonderful, wonderful work. Um, and the third thing is you had the thoracal, uh, the was it the thoracal cervical junction? No, it was the thoracolumbar junction. Um, in your mid back, that was the right was worse than the left and is worse at night. And it also went um, into your shoulders and stuff too. What overall improvement would you give that?
I would say it's about the same with the other ones, so the 40 to 50% in that amount of
Okay.
time.
Okay. All right. Very good. 40 to 50% better. Um, okay. All right. So the fourth thing is the right neck pain, especially when you flexed your head downwards. What percent overall improvement with that?
Uh, that might be like 20 to 30.
Okay.
Still working on that.
Yeah. Okay. And you also have pain in the trapezius muscles there with that.
That's
Number, pardon
uh,
me?
yeah, that's quite a lot better. Maybe like 60%, 70. It's
60
not
to
too much.
70% improvement. And was the right side was worse than the left?
Yes, yes. It was in both areas, but right was worse. Mhm.
And you'd kind of describe it as trapezius muscle spasm and tightness.
Yeah.
That's such a common thing that people have. I hear it all the time. They say it their shoulder, but they really mean the top of their shoulder up here, like, um,
Hmm.
where their trapezius muscle is up there. It's just such a common thing with people. We just see as a recurring theme. All right. The fifth thing is the right upper extremity tingling, which we did cover in the right upper extremity. You said it was, I think, 40 to 50% improvement with the tingling. All right. So a little redundant on that for our viewers. And then the last thing, you had alluded to this earlier, when you were supine or when you laid on your back, and there was pressure from the bed or whatever you were laying on your shoulder, on your, was it your right shoulder? You
Hmm.
had to prop it up. Was that true?
Yeah, yeah. And I haven't had to now.
Okay, and you haven't had to now, you're not having to prop it up anymore.
Mm-mm.
So you're saying that's about 100% improvement?
90. Yeah. It's a little bit painful, but I don't have to prop it up with pillows. So I can
Okay,
actually put some weight on it.
all right, 90%. All right, yeah, we don't want to exaggerate here. All right, so for our viewers, Betsy did start in 2008, but I hadn't seen her in about a year and a half, and she came in about 5 days ago. Um, in and that was April, was it April 20th, 2021. Um, and so now let's go back in when you first came in 2008. We're going to go through the list of those symptoms. And what I'm not saying is, because I know you've done a lot of different interesting things, and I think
Hmm.
it'd be great for you to share those things that you've done. Though we really want to highlight the thing that did the best and most for you overall. Um, and we want to hear that in your words too. But we've got a list of about 20 things that you originally came in with, but we don't want to give the credit to the cranial cervical junctions for all of them. I know you've done some other things. So without further ado, the first thing you came in with in 2008 was ulcerative colitis. And you said possibly it was related to the vagus nerve, that your doctors have told you that. And also you were doctoring with, and so what percent overall improvement would you give that, your ulcerative colitis?
Um, well, I'm completely in remission. I'm not on any medication. But actually, a doctor didn't mention the vagus nerve to me. That was my own research. Um, I had found out that that was possibly the most powerful anti-inflammatory agent in the body, and I was looking at the connection between chronic inflammation and vagus nerve, and possibly vagus nerve impingement from the cranial cervical junction. So
Unbelievable.
that's how I ended up coming in. And I knew I had dealt with scoliosis to some extent, since maybe was discovered maybe in middle school or something like that.
Yeah.
I had been going to a variety of chiropractors, and it didn't seem to really get better. I just kept going, and I don't know. So I knew that that was something to look at as well.
Right. Absolutely.
So
Absolutely.
yeah, ulcerative colitis. I'm not on any medication. I had a flare in 2019, 2 years ago,
Uh-huh.
um, but I was able um, to stop the flare without any medication or anything like that, and I just keep it in remission and by diet, especially avoiding sugar and damaged fats and basically inflammatory foods.
Hmm. Which is interesting because most of the 93% of the American diet is processed foods and animal products, which are all acidic, and are inflammatory. Now, are you saying that that people don't have to live with ulcerative colitis?
Well, that's what I have found, and I was told that I had severe ulcerative colitis that may need surgery,
Sure.
and I'm not on anything, and I didn't need surgery. And I was also told by a gastroenterologist that it had nothing to do with my diet.
Uh-huh. And was that true or was that false?
No, false. Uh,
Well,
yeah.
these are good doctors. These are good people. I don't do this to criticize anyone. These are just wonderful people. A lot of the doctors are just practicing in their knowledge base in what they've been exposed to, and so we want to thank all the doctors out there that work in different areas that are trying to help people, and that's what it's all about, and that's where all the fun's at. Now, are you saying, so what you're saying is this is not a cure-all, changing your diet, but this helped you, that's what you're saying, and it
Oh
caused
yeah.
you to be in complete remission with one flare-up in 2019. Now, oh, I'm
Mhm.
sorry.
No, and it's definitely a full spectrum type thing. So it's not just diet, it's seriously stress and dealing with that, limbic system, retraining, a lot of addressing both the gut and the brain. And so it made sense to me that upper cervical chiropractic in in getting rid of the impingement of the brainstem or the vagus nerve would definitely help in maximizing like the gut brain function. And
Sure.
so that's where like structure I knew just had a lot to do with that. So
And
that's been a huge part.
yeah, it's great. And just for the viewers, we know that 10 out of the 12 pairs of cranial nerves, um, they actually start in the brainstem. And so where the head meets the neck, or what we call the cranial-cervical junction, becomes a very important part of the conversation. And the 10th cranial nerve, for those who haven't bored any of their friends at cocktail parties lately, is also called the wanderer, because the vagus cranial nerve number 10, or the wanderer, innervates the upper 2/3 of the abdomen. So there's a lot of action just going on with the vagus nerve. And then one of the reasons it was such a big deal, because this was the chief complaint you came in with. Can you imagine, what does the cranial cervical junction have to do with ulcerative colitis? Are you crazy? You know, maybe
Mhm.
that's what the audience is thinking about you, or maybe they're thinking that about me. Now, what concerned me is, and I wouldn't think that about you, Betsy, but what concerned me is that you told me that you were hospitalized for 10 days and that you weighed 80 pounds.
Mhm.
And 5 days ago, you told me you weigh 107 pounds. So you're 27 pounds lighter back in 2008 because of this flare up of ulcerative colitis. So this was very serious. They were talking surgery, and you haven't had surgery. So you've been saved. You also told me that, now this is kind of personal. There was bleeding. It was very serious. something that none of the viewers would wish on their mother, their grandmother, their aunt, their sister, their daughter, their friend. And it's very embarrassing, but it almost killed her. And that was going on for 5 weeks. That was just brutal. And you saw a Dr. Trombley in Grand Rapids, Minnesota back in 2008 for the problem. And then someone that came to your rescue, I believe it was Dr. Stephen Davis, who is a naturopath and a chiropractor. Was
Yeah,
that
in
true?
California.
In
Hmm.
California. And
Yeah.
he helped you quite a bit.
Hmm.
So we want to give a shout out to Dr. Davis.
Yeah,
Is he still practicing in California?
probably.
And
Yeah,
what town in California?
Reading.
Reading. All right. So any of those sick and suffering people that are sick and tired of being sick and tired, maybe give Dr. Stephen Davis in Redding, California a call. Maybe he can help you and give you answers that you're looking for.
Yeah.
So you also told me you saw Dr. Lydia Griffith, a physical therapist as well.
Linda. Yeah.
Linda.
Hmm.
Yeah, Linda Griffin. And so that's interesting. So, well, very good. Well, I'll accept a complete remission with one flare up in 2019. And since then, it's been good.
Hmm.
Great. And also, back in 2008, you were taking Oscol. It's a medication for that.
Isacol, methylamine. Hmm.
And what were can you say that again? That's a big word.
Oh, methylamine is the generic word for it.
And what was the
Companion
expensive
Isacol.
word for it?
Yeah, Isacol.
Azicol. Okay. And what is that? A medication for ulcerative colitis?
Yes.
What were the results of that?
Well, when I read the side effects, one of them was may cause intestinal bleeding. So I was kind of confused how how that was supposed to be working for my intestinal bleeding, but it is the go-to medication.
So was that prescribed by a medical doctor?
Hmm. Yeah.
Now, one of the interesting things is not only you were be giving a drug for ulcerative colitis for bleeding, which you were 27 pounds lighter than you are now, and I believe you're fairly thin. I think you would agree with that.
Oh, yeah.
And you couldn't afford to lose any more blood, so that kind of concerned you. So
Mhm.
did the drug work?
Well, I don't think so. I mean,
Did you take it?
yeah, for quite a while, and then I didn't really quite see the point.
Right. Another interesting thing is, well, so you're saying the drug didn't work for you, basically?
Yeah, I mean,
Okay.
I didn't think it was working.
You didn't think it was working. Okay. Well, um, you're in charge of your health, so it's you to decide what's the best thing for you. Um, and so that was the first symptom you came in with. Okay, interesting. So the second symptom you came in with was upper back pain. Now, what percent overall improvement would you give that since 2008?
Well, I guess I would add that I was away from care for a while, and yeah, that's the thing I've struggled with the most for the longest. So that's something we'd be working on right now, actually.
Okay. So for the viewers that are just getting into this, Betsy has been out from under care for a year and a half. In that year and a half, I don't know how well her cranial cervical junction was aligned. Um, she's done different, seen different doctors. Um, and so, but she's saying that she struggled with the most with the upper back. So what percent overall improvement would you give that?
Uh,
0%?
yeah, I mean, it's gone back and forth. And so
Okay.
and then the thing is, when I had gone to you in 2008 and nine, I'm not really sure when I stopped after that, but
Okay.
there was a long time, that I hadn't come in. And it was, mostly because of these flares and things like that, where I was not driving the 4 hours. And
Right.
yeah,
So
so
for the viewers, you were at the time driving from Grand Rapids, Minnesota to Bloomington, Minnesota, about a 4 hour drive from the North Woods, from that cabin in North Woods there in northern
mhm,
Minnesota. But what I'm hearing you say is you're struggling with the upper back the most, and perhaps because you didn't quite have proper access to care and didn't want to do the 8 hour round trip.
Yeah,
Um, so you're telling me that it's really no different, no change, or that it had been improved with care, but the longer you're away from care, that it starts coming back on you. You
exactly
notice
that.
that?
Yeah.
Okay, because I'm not trying to put words in your mouth, but you're saying it's better with care, but
Yes.
with infrequent enough care, like this last one was a year and a half since we saw you. You're saying that your upper back really had some challenges in that time.
Hmm. Yeah.
So I'm going to put 0% improvement with inadequate
Yeah.
care. Now, when you had adequate care, what percent improvement would you give it with adequate care?
Oh, like 80 to 90%. Like it was the most in alignments that I've ever felt. And I've probably gone to, I don't know, 15 or 20 different chiropractors in my lifetime.
Okay. So you're
Different.
saying with adequate care, when you have enough follow through with the 8 hours round trip, the upper back is between 80 to 90%. But with inadequate care, it kind of struggles. And we know it's been a year and a half since we saw you. And I think you stayed overnight in the Twin Cities somewhere, and we saw you 2 days in a row. And so we're starting to, go the right direction in that. Moving forward, you also had right thumb pain. What percent improvement was that?
I mean, it's 100% on that one.
All right. So that's number three, right thumb pain. Number four, and I'll take 100%. That's pretty cool. Did we do anything to your thumb, Betsy?
No, I mean,
Okay.
to my neck, and that affected my thumb.
Right. And so for the viewers, um, can you describe how this works, how your thumb was healed, in your opinion, given
Oh,
that we
well,
didn't do anything to your thumb, Betsy?
it was that nerve pain. So, I mean, I could tell that the problem was stemming from my neck, especially because if I put my head down, then I would feel that pain going through my arm into my hands, and so I would say that as you took the pressure off that nerve, um, then the nerve wasn't irritated and it was not hurting in my thumb.
Okay. Interesting. So for the viewers, I would describe it as the brain cell is connected to the tissue cell via the AT&T wiring of the body. And the AT&T wiring of course, is the nerves, which we've got the central nervous system, which is the brain stem, the brain, the spinal cord is the central nervous system. The peripheral nervous system, or the PNS, is everything else. So the peripheral nervous system is everything off the spinal cord that goes to every cell, tissue, gland, and organ in the body. So without boring our viewers, there's a nerve that starts in the thumb and goes up to the brain through, up the arm, into the shoulder, and into the neck, and then up into the brain, and then goes from the brain, retracing the same step back down the spinal cord, exiting the spinal column at some place in the neck, namely the brachial plexus, C5 to T1, and then going down the shoulder, going down the arm, into the hands, fingers, and thumb. So it's kind of neurology 101, but that's what I find is the most important chink in the armor that people don't understand because they don't think about it. So it's good to hear that your thumb pain is better, Betsy. That's great. So number four thing is fibromyalgia, which you were diagnosed in August of 2006. Now, what percent improvement, if any, with your fibromyalgia, Betsy, would you give it?
Well, now I have an entirely different view of that. But let's just go with like 80 to 90. It's just, yeah, there's some muscle pain and spasms, but I think that's from misalignments, and then the sleep apnea that
Okay.
goes with a lot of this too.
So it's a little muddy and mucky. It's hard to tell what is what.
Hmm.
What is, and who knows, maybe so are you saying that that everyone with fibromyalgia can expect to get these same results?
Oh no. I mean, I don't there can be many different causes, and I think there's, like, thyroid may play into that, and toxicity, and, there's so many different things, and I've detoxed a lot through all of this as well, so, I don't think there's one answer for anything, because I think fibromyalgia too is, a term for a group of symptoms, so really nobody knows what it is other than pain in the muscle fibers, which, like, okay, it describes a symptom.
Sure.
So yeah, it could be sleep apnea, it could be, the skeletal, the structural changes that need to be made, or it could be a lot of things.
Sure. So are you saying, Betsy, that the definition of health is something like um, 100% health or 100% function in mind, body, and spirit? And there's a number of different ways to approach each one of those.
Oh, yes. Yes.
And then each person could be different causes. But what I heard you say is that you did dietary changes, you did cranial cervical junction or a head neck doctor, and you also did a cleansing, a multiple cleansing of your body.
Yeah. And
So,
limbic system retraining, which it was huge as well.
in the limbic system retraining. So for
Mhm.
you, it was a multi-pronged approach. It wasn't just
Oh,
one
yeah.
thing.
Mm-mm.
Now, what part of the approach was medication in the ulcerative colitis and the fibromyalgia improvements?
Oh, how did that help?
Was
Uh,
there any part of medicine, like the traditional medical system, that helped with either of those issues?
that would be 0%.
Okay.
Yeah, no, it just nothing. I was on amitriptyline for the fibromyalgia,
For how
and for
long?
just um, a number of weeks, probably.
And did
Um,
it work for you?
I just remember because I was having so many sleep issues, it knocked me out, but then I would wake up and still not feel rested. And so then I didn't see the point of
Right.
that either. Um,
Mhm.
so yeah, basically the medications were not helpful. That's why I did my
Okay.
research and looked into other potential causes rather than just trying to mask symptoms with
Sure.
medication.
Now, for our friends that are more orientated toward the traditional method of healing in in the West, they might say that you didn't try the drugs long enough. If you just tried the amitriptyline for a number of weeks, but we'll let them have their opinions on that. Um, uh, I just wanted to throw that in. Now, with the fibromyalgia, you were having chest pain, hip pain, and pain going up and down your legs. Was that true?
That sounds right.
And
Hmm.
probably most other places in your body.
Hmm. It
Um,
wasn't severe like some people. Some people cannot be touched.
okay.
And so it did not have a severe form of it.
And it's interesting that you say that because I've taken care of a number of people with fibromyalgia, and those very severe people, you touch them, they're coming off the table.
Yeah. Hmm.
With the work that we do, there's actually physical touch involved. I mean, we don't practice this work behind a big cherry mahogany desk. It's actually practiced live and in person, and there's an element of contact with that. And so we've seen those different spectrums of fibromyalgia. Some of those people you can't touch at all, and other people you can touch and don't know they have it. And then there's everyone else in between that.
Hmm.
Now, the next one, the fifth thing was anemia for the blood loss. What percent overall improvement is that?
I had some blood work done recently, and I think it was back to normal.
Okay. So 100% improvement and normal.
Um, I think so. I mean, it might have been slightly low or something, maybe 90%,
Okay.
something like that.
90%. Fair enough. All right. Good. And now number six, we're on number six for our viewers. Betsy came in, that would have been 13 years ago or 12 and a half years ago. And she came in with a list of 20 things wrong with her. The sixth one was Raynaud's syndrome. And Raynaud's syndrome affected your hands, feet, toes, and fingers where they were white and numb. And it was daily, it was bilateral on both sides of the body. Um, and your right hand was colder than your left hand. So, what percent overall improvement with your Raynaud's syndrome would you give it?
Yeah, so that's another thing about just being under care. And so right now I have that back right now. So it's been bothering me recently. So
Okay. So, would you say, you're saying at some point it did get better?
I think a little bit. It was like it would take more to set it off,
Okay.
um, although it never went away completely. So that's
So,
one thing. Yeah.
okay. So, would it be fair to say that with the Raynaud's syndrome, it was 0% improvement right now, but at some point you did have minimal improvement
Mhm.
um,
Yeah,
in the
could have been.
last 12 and a half years? You've had minimal improvement, but it was very minimal.
Yeah,
Okay.
it's hard to tell sometimes because it depends if I'm like cold or holding onto something cold. It depends what situations arise.
I understand. Thank you for sharing that. The next thing, and this could have been certainly tied with the ulcerative colitis, of course, but I separated it, I demarcated it as number 7, and that was with the 6 month of duration of bloating that you were seeing Dr. Davis, the naturopath of California. What percent overall improvement with the bloating um, have you had?
Uh, I would say 90% because it was actually constant and I looked like I was 5 months pregnant or something all the time. Uh, that's what really helped with that was actually fasting for a week on water. Um, a few different things. Um, and I also maintain a low carb diet, which seems to keep that in check. So I'm not exactly sure, depending on how what I eat.
I understand. Okay. All right. Well, 90%. And then number 8 was maybe tied to the bloating and the ulcerative colitis as well, was the constipation. What percent overall improvement with the constipation?
90%.
Okay. And also with that 10 days of hospitalization that you were also on prednisone as well.
Hmm.
Hmm. Very good. All right. Number 9. Number 9 was the candida. What overall improvement over the last 12 and a half years was the candida?
Oh, 100%. I no longer crave foods. I can go hours without eating. I would say that is completely cured, if I can use that word, or
Well,
intermission.
well, we can use the words that you say. If you say it's cured or on intermission, either way, you don't have it at all, right?
Yeah,
You
no,
just say you don't have it at all.
no, I
How
don't think
long
so.
have you not had it at all?
Years,
Years,
years.
5 years, 10 years, 12 and a half years?
Oh, I don't know, 10 years,
So, okay.
maybe not quite, maybe like 8 or something. Um,
So you've not had it for maybe 8 to 10 years. Would that be fair to say?
yeah, and the like food cravings have gone away completely.
Okay, that's a great thing, especially with bad food cravings, with always hungry or craving
Yeah,
the wrong type of stuff, and
I
that can
hardly
really
ever.
work a number on someone's figure. And in this day and age, it can be pretty have deleterious health effects.
Mhm.
Um, well, very good. Well, thank you for sharing the improvement with the candida. Now, are you implying that this is a cure-all for people with candida?
Oh no. There are a lot of different things again, just like the fibromyalgia, which I think those are really tied together too. But for me, keeping a low carb diet has been a huge thing with the candida and just keeping my blood sugar balanced and then going longer between meals and not feeding any type of like small intestine bacterial overgrowth or fungal overgrowth or anything like that, but allowing the the migrating motor complex to do a clean sweep of the gut in between meals. And I think also the cranial-cervical junction is somehow involved with that, isn't it? Like with the um, just the movement of food through the gut,
So,
peristalsis.
yeah. Oh, I like this. So you're asking me questions now. This is great.
Yes.
This is what this is for. So thank you, and by all means. And so you mentioned the cranial cervical junction, and Betsy had brought up, what does that have to do with the gut? What does the stomach and intestines have to do with the cranial cervical junctions? My question back to you is, what does it not have to do? What does the cranial cervical junction not have to do with the gut? And the reason I say that is, just like you have the nerve that goes from the brain down the arm into the thumb,
Hmm.
you also have a nerve that goes from the brain down the spinal cord and the brain stem, or and then exit the spine and goes to the stomach, or another nerve called the cranial nerve number 10, or the vagus nerve, that starts in the lower part of the brain, or in the brain stem, and it goes through the foramen magnum of the base of the skull, the opening at the base of the skull, and goes alongside the spinal cord, but outside of the spinal cord, and it goes down into the stomach and to the upper two-thirds of the abdomen, innervating the small and large intestine, innervating the stomach, and innervating a whole host of other organs, which within the upper two-thirds of the abdomen. So for those of you that are not sure about the vagus nerve, I would challenge you to Google it or Wikipedia it, the 10th cranial nerve, and get educated. Where does it start? It starts in the brainstem. And so when the cranial cervical junction is not in its proper position, it's locked out of position, it can adversely impact the neurology in the brain and the brainstem, creating problems with wherever those nerves go. And if those nerves happen to go somewhere in the upper two-thirds of the abdomen, it can adversely impact those organ systems. So it's just very interesting and fascinating to me. So many people haven't heard that, Betsy.
Yeah, and I don't know if I had if it's listed there on my forms or whatever, but I also had gastroparesis. Um, I kind of I might have self-diagnosed that one, but I just felt like my stomach would not empty. It just felt like food just sat in my stomach for hours. And doing some research, it sounds like that's what was going on, and it's exactly what you said. Because if my stomach was not getting, that nerve supply, that could have been why it felt like food was just sitting there. Of course, low stomach acid could be an issue as well.
I think this is the case of two super nerds going at it on a Sunday. I mean, because it kind of makes sense from the way you described that, because you had said that you had done fasting,
Hmm.
and that had helped a lot when you water fasted for a week.
Yeah.
Now, Betsy, are you recommending to our viewers that they do non-medically assisted water fasting for a week?
Oh no. No, I don't recommend that.
You
Yes, and
recommend a
also
doctor supervised
yes, yes, yes. And the same
water
thing,
fasting?
getting off the medication like I did, um, that I don't recommend doing what I did. It's better to work with somebody who knows what they're doing. So if you have other issues going on, you know, in my case, it was maybe a simpler thing, but whether you have diabetes or anything else, it's better. It's always better to work with someone who's been medically trained in that.
Sure. Because, everything is going fine until it's not. And then the
Yeah.
question is, now what do you do?
Mm-hmm.
And
Yeah.
so I, like Betsy, would also recommend physician assisted, physician supervision, or healthcare professionals supervision on water fasting or going off medication. That would be a medical doctor or a doctor of osteopathy helping you with that. Um, we don't practice outside of our scope of care or a scope of practice. That's not a service we provide. That's a service we've never provided. So that would be outside of my scope of practice, and I don't know about that. So by all means, use your medical doctor or osteopath to help you in that endeavor if that is a goal of yours. Very interesting that you also mentioned the gastroparesis, that you also had more space between meals. So there was less, so it allowed more time for the stomach to digest all the food, and so on and so forth. And so that really makes sense with that self-diagnosis. And hey, there's the super geek in all of us, right? Self-diagnosing things, stuff like that. But you suspect that
Yes.
you might have had gastroparesis, whatever that means. Yeah, to our viewers, you may not want to bore your friends at cocktail parties about talking about your gastroparesis.
Yeah, your sort of paralyzed stomach, right? Semi-paralyzed stomach.
Yeah, right, right. Yeah,
Yeah.
and it's kind of like the garden hose theory, where there is a bone out of position or the skull misaligned on top of the broomstick, the spinal column, and it's adversely impacting the nerves that go to the stomach. So it kind of makes sense in that regards that it was working better. Now, the next thing was the microbiomes, which you already covered that as well in your great in your great um, description of your gut health condition. So we'll skip to number 11, which was your anxiety. And at the time, you were a double major and you were not working and you were just super stressed out. I mean, I get that. On top of all that, you had all these healthcare issues. And so, what percent overall improvement is your anxiety?
Oh, I mean, everyone's a little stressed, right? So like 95%, I would say. I used to have anxiety attacks where I could not breathe. And that actually happened even when I was driving in the Twin Cities. And I don't have that anymore.
Wow, that's pretty serious.
Mhm.
That's pretty serious. Um, Not breathing is a pretty big deal.
Yeah.
That's great that it's a 95% better with your anxiety. Um, Sorry, I just got to take these notes down. I'm actually writing notes. I didn't get what percent overall improvement was the gut health, the microbiomes gut health, just from a subjective perspective, Betsy?
Oh, well, I got down to it was pretty scary at one point. So, you know, if we're going with like completely healthy and normal, it could be like 80, 85%. I have probably a little bit of work to do yet, but it's way better, way, way better.
Okay. And since a lot of these things are better, does that seem like it's caused you to have less anxiety, less panic attacks, less stopping,
Oh,
driving,
yeah.
driving, just things are better, you found solutions, you found answers, and you're feeling so much better?
Yeah, I mean, there's that's sort of subjective aspect to it, thinking, like, oh yeah, there aren't as many problems, or so I feel better. But then there's the whole gut brain connection. So just that alone, if you're making the correct neurotransmitters because your gut is working the way it's supposed to, then that already is going to lessen the anxiety and depression, in my opinion.
Wow. Well, that's great. I'm glad. I'm glad that those were better. Number 12, you had mentioned gait impairment in 2008, and it was worse on the right lateral or outside part of the foot. And this gait disturbance that you were having affecting your foot was causing you to smash your big toe and to create a bunion.
Mhm.
Compared to all these other issues, the ulcerative colitis, the fibromyalgia, the Raynaud's syndrome, and the anxiety, a bunion doesn't seem like a big deal. but it was a big deal enough for you to bring it up to us back in 2008. Now, what overall improvement would you give us with the symptoms of the bunion?
Oh, 60 maybe. The thing is, I think I've had my atlas out for a while, and so um, obviously to both of us that impacts my gaits, because then I'm walking around with a short right leg. So um, I think it's been like that for a while. So that'll be a matter of getting under care again and kind of rewiring that gait.
So, are you saying after a year and a half of sitting out of this type of care in the Twin Cities here? Are you saying that you need more than 5 days for your body to neuroadapt to be healthy?
Yes.
Okay. All right. So for the viewers, is this like a one-time thing?
No, this is a lifelong thing. Like, not that it's lifelong to improve symptoms, but it's just like, oh, should you eat healthy for like 6 weeks and then you'll get better? No, you can't go back to that way of living. So it's just like anything, you drink water, you eat healthy, you go in and make sure that you are maintaining your adjustments every so often. So that's just really important. It's just like any type of upkeep, like with a car or anything, it's
Mhm.
just a part of keeping a healthy body.
Okay. Well, that's understandable. That makes sense. Now, you alluded to something very interesting, and we're going to go to a break here. We're going to have a little intermission, and then we'll get back to the second. We'll be on number 13, and we'll go through number 20. Um, but before we do, you had mentioned something very interesting about the short leg. And it was kind of like you kind of mentioned, it's kind of between you and I, but really this broadcast is really for the world. It's to share with the world the power of the cranial cervical junction, the power with the proper alignment of the cranial cervical junction post trauma, post injury, post slips, trips, and falls and sports injuries. That's what this conversation is all about. It's for you, the viewer. It's for you, the people, to have less anxiety and depression about what could be creating problems in one's health. And so, Betsy, you had mentioned the short leg. Can you describe what's causing that? And can you describe that for us?
Yeah. So, I mean, if you have a short leg, that can be anatomically, sorry, or functionally. And so, anatomically, it's like literally you have a shorter bone that is creating a shorter leg. Now, an upper cervical chiropractor can check and see, if you make certain adjustments, make sure the atlas is in alignment, whether those two legs are actually the same length, but they were just, one was functionally short by being twisted with like the pelvis being twisted. And Dr. Phillips can explain better. But basically, if your atlas is out, you're going around with possibly a short leg, and it doesn't have to be like, an inch or two. It can be, 1 or 2/16 of an inch, and not 3/16 of an inch. That can make a huge difference, because you're walking all over the place, and that leg, that side of the body, is just getting a lot more impact. And so then that changes also um, how you're going to step on your foot. And so then you might have a tendency to turn your toes out or something, in order to kind of adapt to that shorter leg. And that's what I had going on. So when Dr. Phillips checks me and like gets me back in alignment, and then checks the leg lengths, they're the same. And no, actually, I don't need an orthotic in one shoe to make up for the one short leg. Like, that could be the case if someone actually had an anatomically short leg because they had a shorter bone there. But if you don't, then that seems, I don't understand the point of that, because it's like you're putting a band-aid when there isn't a need for one.
Interesting. So, Betsy, you had talked about the short leg and how one leg isn't as long as the other. Um, what causes that?
As I understand it, it's the atlas being out, and then the spine acting like a chain link, and then if the first link gets turned, then all of them get turned, and everything gets kind of off kilter. And so I think you'll have to explain exactly how the it impacts the pelvis and how the one leg gets pulled up on one side.
And I'd be happy to do that. And thank you for um, putting me to work here. Now, you had also mentioned the atlas. Now, for our viewers, what is the atlas and what does that have to do with the cranial cervical junction?
Oh, the atlas is the first vertebrae of the spine, and right beneath that is the axis. And if the atlas is out, then it can be putting impact on the brainstem, and then negatively impacting nerve flow, um, and also impacting brain function, which is not good. Uh, Definitely those two things, and then just the overall structure then is completely off. So I will let Dr. Phillips explain more.
Okay. I think, by the way, your explanation was fantastic. I mean, that's just excellent.
Thank you.
First of all, with a short leg for our viewers, um, what we mean is a leg length inequality when the patient is non-weight bearing.
Mm,
And there's about a 20-point test where it's an accurate test, which is performed every time that we've seen you, Betsy. We've done that test. And that's the most important test that I know of in all of healthcare. Of course, I'm biased. I am saying that because of my perspective, and I'm sure there's a lot of very important tests. For the work that I do, I've seen that test show me where a problem is when someone's had multiple CAT scans, MRIs, imaging, nerve conduction velocity tests, physical therapy, anti-inflammatories, muscle relaxers, and pain pills, and rounds and rounds and rounds of physical therapy, chiropractic, and all these other things, and they're still walking around on a short leg. That's a problem
hmm
because that short leg is, I don't want to say very easy to diagnose because it could be very easily misdiagnosed in the hands of someone that's not properly trained. With a cranial cervical junction head and neck doctor, they can diagnose that for a person. And so in your particular case, you had come in with a left short leg, an eighth of an inch plus. So a little bit more than an eighth of an inch, but less than 3/16 of an inch.
Oh, this last time or initially?
Initially, this is back in 2008.
Oh, okay. So it switched to my right leg then. Okay.
So now, but an eighth of an inch, I mean,
Yeah,
that shouldn't
not
be
much.
very much, should it?
Yeah.
Do you think if an untrained person looked at a non-weight bearing person and looked at their leg length and they look pretty even, do you think that would be accurate? Do you think they could miss a quarter of an eighth of an inch?
hmm
That's the problem. So if a layperson looked at you, they'd probably say, or a skeptic looked at you, they perhaps might say, I don't see a problem. I don't know what he's talking about.
I think you can also look at people's shoes and see which one, if one is worn a lot more, you can just see the impact of that, even though that's, not an important thing, maybe in most people's eyes, but you can see how over time just having a short leg impacts the bottoms of your shoes.
Right. Interesting thing while we're talking about the short leg syndrome, you talk about not an important thing in most people's eyes. That's actually why we're doing this podcast, because
Right. Yeah.
us as human beings have a tendency to be the greatest minimizers. And I would propose that the biggest issue in your case was a cranial cervical junction issue in addition to dietary issues, in addition to probably one or two other major factors. But
Yeah.
that's the focus of our conversation right now, is the
Mhm.
cranial cervical junction in a relationship. As we start our intermission now, if people want to take a bathroom break, or if they want to go get some popcorn or some snacks and come back and join us, we're going to take a 5-minute break. So please, by all means, do that. We're going to continue to geek out just a little bit on the short leg syndrome that you had talked about. You had talked about it wouldn't seem like a big deal to most people, but I'd propose it was the very thing that got to the root cause of the problem, because the short leg syndrome is in fact caused in most cases if it's a there's a structural short leg and a functional short leg. A structural short leg is not very common. I would say it's less than 1 to 5% of the time, and probably less than 1% of the time, where the person truly has an anatomically short leg. Um, Now, the person with an anatomically short leg, it could be anatomically short because they have a head and neck or cranial cervical junction misalignment, in addition to a structurally short leg. But that's the exception to the rule. The 95 to 99% of the time, there's an anatomic short leg. There's an anatomically short leg when you're non-weight bearing due to a um, cranial cervical junction impairment of misalignment, creating a brain issue that allows the body to react and adapt to the cranial cervical junction misalignment. So, however it's misaligned, it causes one shoulder to be higher than the other, or it may cause the head to tilt to one side or the other, or
Yeah.
maybe translate one shoulder closer to one shoulder than the other shoulder, or maybe the head is backwards or forwards more than it should be, or maybe it's twisted or turned in one direction or the other direction, or maybe one shoulder is higher than the other, or one trapezius muscle is higher than the other trapezius muscle on the other side, or or maybe one hip when they're weight bearing is higher than the other compared to the other side. And so that's what Betsy's talking about when she's talking about a short leg. We can talk about a leg length inequality, non-weight bearing. We can talk about a full body distortion, or maybe we can simplify it that the whole body is twisted because there's a brain problem, because the bowling ball sitting on top of the broomstick is misaligned, creating a brain problem. But however you want to think about it, I think this is probably the single biggest issue when it comes to the part of healthcare when we're talking about structure function, neurologic healthcare, we're talking about vascular healthcare, we're talking about structure function healthcare, neurological, musculoskeletal healthcare. If you've got a short leg, you've got a problem. And 1% of cranial cervical junction doctors are uh, are qualified to really correct the most difficult cases. And I believe that, Betsy, you kind of fall into that category. Fortunately, back in 2008, is you're a heavyweight case. You're the toughest of the toughest. You're the most difficult. And you need the best minds in all of healthcare to address these situations. And tied with your research background, that made it profound in the sense that you sought out another number of doctors for care. Is that right?
Hmm. Yeah. In different disciplines as well.
In different disciplines. Now, as we're coming back from our break, um, from our intermission, how many specialists have you seen? How many specialists, physical therapists,
Mhm.
chiropractors, and other massage therapists have you seen for this situate for your issues? Would you
Uh,
estimate 10,
uh,
20, 30, 50, 100?
I think 50. I really do, at least. Yeah.
How many of those, you're saying at least 50?
Yeah, I think so if you add them all up. Yeah.
And what are the top 3 or 4 doctors and their specialties and where they're located, listing them from the one that helped you the most? And this is for the viewers and not for me, Betsy. So please, this is for you to share with the world. Is what would be the top 3 or 4 or 5 doctors, their specialties, and where they're located that
Okay.
helped you?
Well, definitely you, and in Bloomington, Minnesota, and also Joy Moeller, doing myofunctional therapy after I got a tongue tie release that she had recommended, and that really tied a lot into the structural issues I found. Um,
And where is she
and
located and what's her specialty?
she's a myofunctional therapist, and she's in the Los Angeles area. I can't remember exactly the suburb. Um, and then um, Annie Hopper of dynamic neural retraining system, the limbic retraining, that has been huge for me. And
What's her specialty and where's she located?
and she's in Canada. I don't know which city, but
Okay.
yeah. And then Dr. Stafford, a dentist in Fort Atkinson, Wisconsin, here. And that was for expanding my upper palate and opening up my airway, which had been minimized to 1.2 millimeters, and that was contributing to sleep apnea, which was contributing to chronic inflammation and limbic overdrive. And then Dr. Adiel Taloran, who was at the time in Minneapolis, and he's a functional medicine MD, as well as chiropractor and nutritionist. Those are some of the main things where I would say chiropractic, tongue tie release, and that was done at the Breathe Institutes in LA. Dr. Zaghi there. And
Dr.
yeah,
Zaki,
Zaghi at the
and
Breathe
that's in
Institute
LA.
in Los Angeles. Yep.
And that was a tongue tie release.
Mm-hmm.
Mm-hmm.
Yep.
Wow.
So you can see a lot of the things were actually structural. The dietary things I feel like were a lot easier, once I've been dealing with the structural things. And then also for me, a lower carb diet has actually been huge. And then finding out about, for me, doing the fasting for a week is what seems to have gotten rid of what I think was a small intestine bacterial overgrowth, just because there's a major die-off from fasting for a week. So that was really huge. So I would say those things. If I were, I guess one other thing would be chiropractic neurology, Minnesota, or now it's maybe called Midwest Functional Neurology. They're also in Minneapolis, and Dr. Schmo there. And then I also continue to work back in Grand Rapids with North Lakes Chiropractic, doing the functional neurology, and that was Dr. Colby Condos. And so that's where learning eye exercises really helps in sometimes actually in even releasing my neck. And I think improved proprioception, improved my tracking ability. I could actually catch a ball after working with Dr. Schmo there in Minneapolis, which I just thought I was bad at sports before. And it turns out that I just had trouble tracking objects coming toward me. So I would say that that is another huge part that I would say the chiropractic neurology alongside upper cervical work.
Okay, so that's a great explanation. So if I can summarize, and we're getting back from our break here, and we're going to cover um, symptoms 13 through symptoms number 20. But before we do, I want to give a shout out to all these wonderful physicians, doctors, chiropractors, therapists, and all other healthcare providers that are trying to help the sick get well and keep the well that way. So I want to give a shout out to Dr. Joyce Meyer with the tongue tie release in LA.
Oh, and that's Joy Moeller.
Joy.
And she's been interviewed on Dr. Mercola's website as well.
Oh, okay.
And she is not a doctor. She's actually a myofunctional therapist.
She's a myofunctional therapist in the LA area.
Hmm.
That's even better. Shout out to Dr. Joy Moeller. Great, if I said her name right.
Yeah, she's not a doctor, so I don't want to, I'm just saying that. Yeah.
Gotcha. The,
But
the myofascial, the wonderful myofascial therapist, Joy Moeller. And the next one was Annie Hopper from Canada, the limbic retraining. The next doctor was, or that doctor was from, then there was the dentist, Dr. Stafford in the Fort Atkins, Wisconsin area that helped you expand your upper palate to
yeah,
increase your
Bender.
airway from 1.2 millimeters. That helped you tremendously with your sleep apnea. And I know you had suffered with that just tremendously with the work with the cranial-cervical junction. Sometimes that helps. Sleep apnea, sometimes it's 100% helpful, but most of the time it's not. In your case, it wasn't. You actually had a dentist work on you. Praise God for Dr. Stafford and Fort Atkinson's. And you talked about Dr. Adele Tellerin, and he was an MD with functional medicine and a nutritionist and just a fantastic doctor. Where was he located, Dr. Tellerin?
Tolerant. Yeah, he is. I don't know, I think he might be in Florida now, but he was in Minneapolis at the time, and he owned the Ecopolitan restaurant there too. He is the one who discovered that I had histaminosis, or
Okay.
histamine intolerance, mast cell activation syndrome. And learning about that has also been a life-changing bit of information, as
Wow.
that changed my diet. I had been following a GAPS diet before and wondering why I was getting worse. And it turned out that I was reacting to all those fermented foods because I had histaminosis, high histamine, mast cell activation syndrome. Yeah.
Wow. I can barely think about those words, much less pronounce those words, but I really appreciate your research mind, Betsy. It's great. And also, we want to give a shout out to Dr. Zogi from California with a tongue tie release. Um, Also, the chiropractic neurologist in Minneapolis. Um, Remind me what his name was.
That's Dr. Schmo,
Dr. Schmo.
SCHMO.
I love that name.
Hmm.
Sorry, I didn't mean to cut you off. Dr. Schmo. And
Yes.
he's in Minneapolis.
Yes, he has. I think now it's called Midwest Cranial Center, Midwest. Anyway, he does functional neurology.
Okay, so the functional neurologist, Dr. Schmo with the Midwest Cranial Center. A shout out to him. Thank you for all you do. And then the follow-up work was Dr. Colby at North Lakes Chiropractic, also a functional neurologist um, that has helped you. And along with those other 50 specialists that maybe didn't particularly help you, but it was part of your path and is part of the discovery process. And sometimes it's just ruling things out and passing on to the next person that maybe can evaluate you for something else. And try to
Actually,
get down to the
that's exactly right. Each one I at least had one or multiple takeaways from, and then that spurred me on to the next thing. And so I would say everyone has been helpful. along the way, I've learned something from each one of them.
That's great. Wow. So thank you for sharing that, Betsy. So now we're going to go ahead and we're going to continue our clinical comprehensive case history that we started back in October 31st of 2008 when um, Betsy first came into the clinic in the Twin Cities here. And the number 13th symptom was bilateral temporal headache on both sides of her temporals, the right and left side. What percent overall improvement was that headache?
Oh, that's a lot better. I might have one occasionally, but it was really probably from clenching my teeth because of sleep apnea. So 95%, it just very occasionally do I have a headache. Um, and that's how I found out I had sleep apnea is apparently the TMJ issues, can also be a red flag for sleep apnea. So I decided to have that tested, and sure enough, yeah. So.
Mm-hmm. And when we talk about the temporal mandibular joint, or a lot of people just call it the TM joint or the TMJ, you had that, and you had a lot of occlusion work, bracing work, all sorts of dental interventions um,
Yeah.
um, as well.
Yeah, that's what I'm doing now. So
Yeah,
that's her.
with the braces.
Yeah, yeah.
It's also taking off, making you look quite a bit younger. I mean, you weren't looking that
Yes.
old before, but now you're kind of looking like, I mean, I don't know how many years it's taken
Cool.
off. I mean, I don't know how much you want to pay me, but I'll say it took off 100 years, with the braces. But it's interesting when you put braces on someone, they really do look young.
Mhm.
And who says you can't give a big smile when you have braces on, right?
Yes, yes, yeah. That's
Maybe
all.
not right after a big meal or something like
All
that,
right.
but you know,
Yes.
so that's great. Another factor with the temporomandibular joint is the occlusive surfaces of the upper and lower teeth, um, both parts of the jaw and the TM joints themselves has to do with the brainstem and the cranial-cervical junction. There's an intimate connection between the cranial-cervical junction and the nerves, be it the cranial nerves and or the spinal nerves that come off the cord and innervate the head, neck, and face. And so the temporomandibular joint, I believe, is the most neurologically enriched joint in the entire body. And so the thing that sets that joint is the brain. And so there's another piece of that, and that's the cranial cervical junction work, alignment work that can benefit the temporomandibular joint itself. The 14th thing was dizziness. Betsy, what percent overall improvement would you give your dizziness?
100%. Yeah.
So your dizziness is 100% better.
Yeah, I don't have that anymore.
Um, how long has it been better?
I didn't remember that I had it. So a good decade, I guess.
Okay.
Mm.
Wow. Now, to our viewers, it almost kind of sounds like a cure-all. I mean, we're on number 14. We've been at this for, I don't know, for an hour or so. And your dizziness is 100% improved. And would you say that this is a cure-all, this cranial cervical junction work, alignment work is a cure-all for dizziness?
Mm. For some people, it could be. It depends what's causing the dizziness. If it's a misalignment. I also, as I mentioned, have mast cell activation syndrome, and with that also comes dizziness. So it kind of, and also misalignments can set off the mast cells, which can set off the dizziness. So it's hard to say exactly, but I would say that would be a place to start. That's probably the first place I would start if anyone had chronic dizziness, is I would first go to an upper cervical chiropractor like you.
So are you saying there's a connection between the cranial cervical junction and dizziness?
Well, I think there is, yeah. That's the
Okay.
first thing I would check.
Okay. So it's very interesting because of course, there is no cure all. Chiropractic is not a cure for anything. I've never cured anything. I've never claimed to cure even one thing. I've never cured anything. But the things that I do claim is four different things. One is I claim to locate uh, the neurologic vascular problem. Usually it's a neurovascular problem, and accept it where we find it. So once we locate the problem, we analyze the problem. And that's the second thing, is analyzing the problem. And what we use is the most sophisticated three-directional imaging in all of healthcare to determine how how the structure is misaligned in three dimensions, and how the buckle needs to be approached to realignment, and how to prove that on post imaging and give us more information on how to even do a better job after the post imaging. So that's the locate the problem, analyze the problem. The third thing that we do is to correct the alignment of the cranial cervical junction using the most science that we have. This work has been around since the early 1930s. It was taught at a school. Now it's a college, and some of these educational facilities are universities that specialize in the cranial cervical junction, or that at least focus in the cranial cervical junction. They actually don't specialize in it, but they focus in it. So actually that's a legal jurisprudence term. So we locate it, analyze it, correct it. And the last part is the most boring, mundane thing in the world. And that's, Betsy, what you alluded to earlier. That's monitoring it over a lifetime. And that's what you had said. That's what I recommend to about 80% of the people under care. Is about 80% of the people have some level of permanency, meaning when the injury occurred, and we're going to get to yours, Betsy. um, when the injury occurred, it causes stretching, if not tearing, of the connective tissue that holds the head, neck, and spine together. So we're dealing with an inherent weakness that's going to always be there. And so that's why it can go from the good position to a bad position. And then with special corrective procedures, it can go back into the improved position again. So I'm going to show you a little picture of that, if I can find one for our viewers here. Sorry, there's a little distraction. So this is probably not very scientific, but here would be, for our viewers, here would be kind of an explanation of that. And so you see the held position where there's a proper alignment, and then there would be some sort of injury or damage to the human body. And then there would be the sick pattern where the head and neck is misaligned. And when that occurs, head neck misalignment, all sorts of problems depending on what nerves are being pinched on. Betsy, can you see this picture here?
Oh, yeah.
Okay, so that's the best way I could describe it, is just show you this picture here. So, so, um, so that's the picture of that head neck misalignment, um, and the dizziness. So interestingly enough, with the dizziness issue, that is the number one symptom that we find is helped in our clinic. So I would say about 9 out of 10 cases get better with their dizziness, as long as their cranial cervical junction is being monitored and it's in the healthy position and not the sick position. And so dizziness is something I don't claim to cure, but that gets the best results. And it gets not only the best results, but it's the one condition that usually gets between 80 and 100% better. But now there is that 1 out of 10 cases, Betsy, that it either doesn't touch it or just helps it a little bit or moderately. And so we do see cases like that too. But with the dizziness in particularly, this is the first person I would see, first doctor on the list of specialists would be a cranial-cervical junction doctor. Now, the 15th symptom that you had, Betsy, was cracking. You were having cracking on the left more than the right since 2003 when it started. What percent overall improvement, if any, is the cracking?
That's another thing that being away from care for a while, it came back again. Except for since 5 days ago, when I was there, it's improved again. So it
Okay,
makes a huge difference when I'm in, and then I won't have the cracking, and that's how I can usually tell that I'm really out. Although I may be out without having the cracking.
okay. So for our viewers, you're using some language again that they don't
Yeah,
understand. That's
sorry,
okay.
the atlas.
I have a picture here. And
Yes.
so I'm going to try to get this on our screen again. Again, we're not very high tech around here. Hey, we're working on it. It's a process. But what Betsy is saying is that when she's in the in position, her cracking is better to the tune of what, Betsy? Between 80 and 100% improvement with the
Yeah.
cracking?
Hmm.
Is that fair to say?
Yeah, 100% sometimes. Yeah.
Okay, 100%, 80 to 100%, but sometimes 100% improvement. It's completely gone when you're holding your alignment. But when your
Hmm.
alignment isn't holding and you've been out of under care, minus the last 5 days, you've been out from under care for about a year and a half. So you're saying the cracking has kind of come back.
Yes, and it was somewhat improved with being under NUCA care as
Okay.
well. So it's just yeah, this seems to work a little bit better for me.
Um, and so what we may be implying is that your head and neck was in the sick position for at least a part of the last year and a half,
Hmm.
and that the cracking has come back.
Yeah.
So Betsy, did we ever make a claim that this alignment would hold the position, the healthy position forever?
Oh no. No. And it depends what you've been doing in between adjustments too, stress levels and, you know, get hit in the head with a basketball or something, that's definitely going to cause a problem.
Sure. So you're saying if you had some sort of injury or trauma, or maybe even stress, or maybe even some sort of chemical trauma that
Yeah.
impacted the brain and body, that it could in fact put you from a healthy position that was in alignment or an improved alignment to an out of alignment position of sickness. Um, is that what you're kind of saying?
Yes, and I think it could be any type of stress, just like you said, it could be chemical stress or I mean electromagnetic stress, anything that puts the body out of a state of balance. You know, I think that it could be a number of things. So not just emotional stress or job stress.
Fair enough, and thank you for sharing that. And I've got the pictures, and sometimes the pictures tell 1,000 words or 10,000 words.
Yeah.
So very good. Well, that kind of helps clear up the waters a little bit. So the cracking has come back, but it was near 100% improvement in alignment, 80 to 100% improvement in alignment. Um, Without care, it comes back.
Yes, and then I'm also changing my bites in the meantime, and I know that the bites and the craniocervical junction are just like this, so
Right
they,
together.
as this is changing, this needs more care, I think, for me.
Sure. Um, Very good. Okay, we're going to go on to the next one, which I think is a little redundant, is number 16. We did talk a lot about your digestion, your stomach, your gut health, ulcerative colitis, and all these other factors. But I'm going to make a 16th category of digestion impairment. What percent overall improvement have you had with digestion impairment since 2008?
Do you mean like absorption or what are you thinking?
Well, you had told me you just had problems digesting food.
Yeah, it's a lot better. So, for the most part, I would say, um, I'd say 90%. Occasionally there, something is off.
Gotcha. Okay, fair enough. And number 17, heartburn. What percent overall improvement is your heartburn?
Oh, 95%. I rarely have heartburn.
Okay. So your heartburn is 95% better. Wow, this is just incredible that you've done all this work to actually get this health improvement.
Yeah.
Isn't it unbelievable?
Yeah, some things I actually forget about because, I can't relate. I don't even know if it's on there or not. Is depression on there?
Yeah, I'm getting to that.
Oh,
Hold that
oh, okay.
thought.
Okay.
So, because I'm thinking of what is a viewer thinking when you're talking about all this stuff. Maybe they turned it off after 2 minutes because it's just going to be too in depth and they don't want to think, and I get that. But I would challenge the viewers to don't put your health in um, in your physician's hands exclusively. You really want to take charge of your health and be the general contractor.
Yeah, exactly.
Betsy, you are the
Mhm.
general contractor of your health. Isn't that what you just got done spending the last hour telling us?
Yeah, in fact, that's a term that I use too, because I feel like I have to choose when to bring on which experts. And, basically all of them think that you should start with them. So then you're kind of like, okay, which makes the most sense. But in a way, it's like if your structure is off, then it's going to be pretty hard for anything else to work the way it's supposed to because you're not getting the nerve supply or the blood flow, the oxygen, you need all those things to repair. So I guess that's kind of where I would start now, just knowing what I know. And yeah, they all seem unrelated in some ways, but if you think about it, they're really all like gut and brain related. And then when you're talking the gut, then that's the immune system, and that's where like the autoimmune disease came in and all that kind of thing. So I think if you're focusing on the gut brain and the vagus nerve is the connection between the two, so then you're looking at, again, the cranial-cervical junction for making sure that your vagus nerve at least is not being impaired.
Wow, well said. Huh. I guess I should have go back to school and try to become a summa cum laude. That's not easy to do.
I don't know. Thank you.
You're welcome. Sorry, I didn't mean to embarrass you or nothing, but it was a great explanation nonetheless, and I just really appreciate it because my peer group are physicians, PhDs, researchers, lay people that have had a positive benefit to humanity. So I just appreciate the explanations and just the well thought out um, mindset and tracking where to do it, what to do it, when to do it type thing, the sequencing of it. Now, the 18th thing, going back to your comparative case history that we're taking, 12 and a half years later, starting back in '08, you told me about the insomnia. You alluded to it earlier. What percent overall improvement in the last 12 and a half years in your insomnia?
Well, that's gone back and forth. Once I found out I had sleep apnea, which I had suspected, and then had to go around the system to actually get tested. Mm, yeah, that's one thing I will add is, people think that you have to be overweight and over 60 and have a big neck or something. Like the traditional idea of sleep apnea is just it's outdated. It's not all tied to metabolic syndrome and having too much fat around the neck. It can be a structural issue, which can be the cranial-cervical junction, and also can be the maxilla being too far back and not having proper facial developments for a number of reasons, including a tongue tie, which I had. Um, and so that's another thing to look at. And so when I was trying to go just through a sleep doctor, to go get tested for sleep apnea, she turned me away and said there's no possible way I would have sleep apnea because, I'm not overweight and, I'm small. But that was not the case. So I actually went through my biological dentist who had a take-home sleep study and was able to get it done that way and then have it analyzed by sleep doctors. And sure enough, airway was 1.2 millimeters. And then that's where I ended up going for the tongue tie release, working with the myofunctional therapist. And then going from there. So and then of course now the appliance as well as braces. So the sleep apnea, that's the thing. So at one point, I was 3 days without sleeping at all. Back when I was coming to you in 2008 and 9, I could go all night without sleeping until like 4 a.m. Um, and it's been back and forth. That's probably one of the things I've struggled with the longest, but now I would say my airway must be opening up. I'm starting to sleep a bit better. But there are so many contributors to insomnia. There's not one answer. So that is definitely something I'll put out there. I would say, it might be at this point 70% better than what it was. So we're still working on that, but there can be a number of things that over time go out of balance just from because having a circadian rhythm dysregulation after having sleep apnea for so long. So it can be a process.
Well, thank you for sharing that. 70% improvement in insomnia is a big deal, and you really worked. I kind of describe it as people or patients or sick people fighting for their right to get better. And
Yeah.
usually what it means is lifestyle stuff, but sometimes it means getting the right physician, doctor, therapist as well, or doing the proper follow through with that therapist, dentist, doctor, physician, PhD, and fighting for your right for that through snowstorms, through what you come see me 4 hour one way. You were coming from by way of northern woods of Minnesota, 4 hour one way. Now you're coming from Madison, Wisconsin, what, 4.5 hours one way.
4 hours, yeah.
And I actually wasn't your first choice for cranial-cervical junction doctors, but you'd found that this just happened to work a little bit better in your particular case. But you of all people have fought for your right to get better. And I think what we are both trying to do here is fight for the people's right to get better. And that's you, our viewers. If you're suffering from a condition that you've been told that you would be on those drugs for the rest of your life, that you should just go home and give up and lay in bed for the rest of your life, that you just need to get used to it, that you're just getting older, or that you'll never, don't expect a miracle, or someone that's tried to dumb you down, or to say that, don't worry about your health, that's my job. I think it's everyone's job. And, we quoted 93% of the average American's diet is processed food and animal products. I mean, just with the processed foods alone, how could you possibly be healthy? And that's just the tip of the iceberg. So I would just encourage those out there that if you're sick and tired of being sick and tired, if you want to live differently, if you're willing to claw and fight your way back to health, that there possibly is some neurovascular physiologic solution to your problem that is perhaps a little outside the traditional approach that you've been doctoring in at this particular time. So thank you for all you YouTube warriors out there that are struggling, and which leads me to my next question. Depression was your number 19 thing that you had brought up earlier, but I'd asked you to kind of hold off on that.
Yeah.
What percent overall improvement with your depression, Betsy?
I would say that's 100%. Yeah.
Wow. So now you've done a lot of different things. What have been the top one, two, or three things that have helped with your depression?
Um, hmm. I think diet, no matter what, is going to be huge. I really think sleep has a lot of impact on that. Um, both things actually would impact inflammation levels in the brain. And I'm inclined to think that that's a major cause for a whole lot of people. And so, if you're eating a lot of sugar and you have high blood sugar, they're calling Alzheimer's type 3 diabetes for a reason, where it's all the inflammatory foods that are causing this brain inflammation. And I think that's a huge part of it. And so then, if you're thinking things that affect the brain and inflammation levels, again, that's where, chiropractic care can come in, because again, getting adequate blood flow and oxygen levels, to the brain. And that's where like the sleep apnea came in because I wasn't getting adequate oxygen levels. You know, I was told I had hypoxia or low oxygen levels in my body. And so I do think the lack of sleep as well as the lack of oxygen contributed a whole lot. And then another thing I would say is really a lot more important than most people realize is mindset. And things like gratitude and optimism, and just looking at the good things in life, and I mean, frankly, not spending a lot of time watching the news and things like that, but really looking at what's going well, because that affects like the limbic system of the brain, and being stuck in that fight or flight state. And so that's where limbic system retraining was really helpful for me. Um, and a huge part of that is actually looking at, well, what's going well, and taking some attention away from all of the like, oh, all the things we just mentioned, all the negative symptoms, because the more that we focus on those, it's just like hardwiring that in. And so mindset is another one that I would say as far as depression, because you have to train in, optimism and happiness and teach your body what it feels like to be happy.
Well, thank you for that. Wow, just a great explanation. Um, Not to put too fine a point on it, um, and I don't want to speak out of bounds or go over your head, but when you said chiropractic, this is probably a good time to bring this up because this is what this whole podcast or this conversation, the junction conversation is all about. But when you say the word chiropractic, that 12-letter word, what you mean is cranial-cervical junction doctors, which in the state of Minnesota is approximately 1% of all chiropractors in the state.
Mhm.
So for the sake of math, there's I don't know how many, but it's about 1 out of 100. But when you say the word chiropractic, you're really talking about the 1 out of 100
Yes,
uh,
yes.
chiropractors that are no better than a regular chiropractor or no worse. They're just a DC, but they happen to focus, an area of focus in their clinics is in the cranial-cervical junction. And they do that with a high degree of specificity. And there's a criteria for that. So when you call up the local chiropractor, you asked him, and this just happened, by the way, someone that in my clinic that had been saved from neck surgery with this focused care on the cranial cervical junction, he's trying to find care for someone that he's related to in southern Minnesota. Well, he found this great chiropractor in northern Iowa that he wants to get my permission to make a referral for his family member to go to this chiropractor with a great reputation, by the way. And he was asking me, should I make the referral? And he goes, I know you want me to make the referral here, basically. Should I make the referral? And well, we have a criteria for it. And so let me share the criteria for it, because so the average person out there can find one of these wonderful people. The first criteria I'd say is go to upcspine.com. Upcspine.com, you can find a cranial cervical junction doctor. Now, that doesn't mean they're all super skilled, or there's different levels of skill levels. There's different technical ways, protocols, or techniques. And some might work better for certain people than others. But some of the criteria that, according to the Diplomat and Cranial Cervical Junction procedures, have for a cranial cervical junction doctor would be that they image the area in 3 different directions. And in most techniques, if, well, there's one I can think of or two that don't, of the 7 or 10 legitimate cranial cervical techniques, they do actually before and after, or pre and post imaging, to make sure they do what they claim to do, which is align the cranial cervical junction or align the head on the neck. And they've got post X-rays or post imaging or post cone beam CT scans proving that assertion. That would be number one. Number two is they would have a tilting bucky on their X-ray unit in their clinic. Number three is they would have a head positioning device on their bucky that tilts in their clinic. Number four is they would have charts and posters on the wall that would focus on the cranial cervical junction and the neurovascular problems that can result on that. So they had specialized language that they would talk about this. Number five, they would have specialized tables to perform the corrective work. Some of the tables are low to the ground, other like a Nuka table or a Blair table or a Palmer upper cervical toggle recoil table. Some of the tables are high up, like an orthospinology table, like an Atlas orthogonal table or an Epic table or an advanced orthogonal table, just to name some techniques. And the Atlas orthogonal table is a $26,000 table mounted instrument that can only correct one bone in the whole body. And that bone is the Atlas or cervical one, which is one half of the cranial cervical junction. The other half is the cranium, the base of the cranium or the skull. So that's the sixth. The seventh one and most important one is that they would have unique tests that are unique to the cranial cervical junction doctors. Some of those tests would be thermography, although some other chiropractic specialties might use thermography. And one that comes to mind is Gonstead chiropractors. They use thermography. Now, cranial cervical junction doctors, they use pattern analysis, which is right out of B.J. Palmer Chiropractic College, first chiropractic college in the world. And they use pattern analysis and not break analysis. So they would actually have a graph with thermography. Other testing would be one of the tests that we discussed already. That would be the short leg test or the leg length inequality test, where you're either laying face down or face up, depending on what technique you're doing. My mentor did 3 different positions on every visit when a nerve test was scheduled of a leg check or a leg length inequality test. And then I would say there's a whole bunch of other, I guess the 8th criteria is that they have a high, that how do I put this? That they tend to see conditions that are outside the norm of a musculoskeletal doctor. They would see neurologic conditions, vascular conditions, conditions that are seemingly diseases and pathologies that are seemingly unrelated to the brain. And so that would be number 8. Number 9 would be that the average case, uh, a lot of things get better. Like, for example, in my practice, um, probably about 2/3 of symptoms generally get better with care. Now, that isn't to claim that if someone came in, that 2/3 of their stuff would get better. No, I'm saying that's my observation over 15 years. Now, I don't have any double-blinded studies uh, or an actuary that I've hired full-time. That's just an estimate by me in one person. Now, maybe if someone comes in, they get low results, maybe nothing gets better. That would be 0% improvement. We've had that before. I would say that would be about 1 out of 10 people get 0% better, or maybe minimal, maybe 0 to 10% better, but minimal to a point where it wasn't worth it. Or maybe they quit before they saw the real value of it. That was only one small part of the care they really needed. But it really wasn't the big part of what they needed. But the average case, about 2/3 of the thing gets better. Now, we're still not done going through your case history, and I know I'm looking down right now, but I would say everything has gotten better. But I would also say, in Betsy's case, but I would also say not all of them are attributed 100% to the cranial-cervical junction. I would say probably a lot of them would be attributed to things outside of the cranial-cervical junction. And then I would say also a number of them, maybe a small majority, would be a little bit of both. Maybe, and I don't know if you'd agree with this, and I would say, Betsy, well, what do you think? Do you think a small or a majority of the symptoms, maybe both the cranial-cervical junction issues causing brain issues was one part of it, but the other part is what the other physician or doctor or therapist brought to the table?
Yeah, it was definitely a combination of factors. I think that number one is probably getting the body out of a stressed state. And so, like, if you were in balance, even structurally, that's helping, to get out of the stressed state because your body is closer to homeostasis. So if you can keep removing all of the aggravating factors. So if, you have subluxation, then that's aggravating the problem. If you're eating a bunch of sugar, that's aggravating the problem. If you have high stress in your life, and that's just another thing. Whether you are living right next to a cell phone tower, whether you are, all these different things. Somebody is you're putting in a carpet in your house and you got all of the fumes from that. It's all of the things that are creating stress in the body. So the more aggravating factors that you can remove, the more likely we're going to get better and get better faster.
Interesting. Well, thank you for that explanation. I'm going to go back to, you used a word called a subluxation. We're going to get back to that word, but before we do, I hope that kind of clears up for the viewers. When you call a health clinic, you should be able to determine if they're in fact a cranial-cervical junction focused doctor, or if they're a general practitioner in the field of neurologic, structural, functional healthcare, and to be able to determine what kind of doctor they are for your needs and what you're looking for. So we've got that. We've got the depression. It's 100% improved. I mean, that's just so exciting.
Oh yeah, yeah. Mm-hmm.
I mean, life is good, Betsy.
Yeah.
Right? What did they say? In the psychiatric wards, there's no one's laughing, no one's smiling, no one's having fun.
Oh really? I don't know. I haven't heard that.
Okay. Well, what I hear, and I don't know this firsthand, but I hear that there's not a lot of laughing going on in the psychiatric ward. There's a lot of
Oh,
agony, misery. Some people there against their will. Some people are going through a bad bout, and so on and so forth.
mm,
Speaking of which, the B.J. Palmer, who developed the cranial-cervical junction work, he had actually a sanitarium called Clearview Sanitarium, and it's my understanding that over 50% of the people left after less than 4 to 6 weeks, and it
mm,
was due to improving the alignment of the cranial-cervical junction. That's quite interesting to me, quite fascinating. And I know firsthand from my brother, as he's been under care for 5 years of the cranial-cervical junction, and his schizophrenia was improved, along with his sciatica and his bulging disc that he was about to get operated on.
mhm,
So, but with that said, you had mentioned the word term subluxation, Betsy.
mhm.
Can you share with our viewers what that means?
Just in layman's terms, which is all I can speak from, really, is just a misalignment where the bone in the vertebrae, it's just not in the right place, and so it could be pinching on a nerve and creating problems. So that's all I can speak to.
Okay.
I'll let you add.
Okay. No, I think it's a great explanation. There would be a misalignment. You basically said a, um, a subluxation is a misalignment in the spinal column that adversely impacts the brain and or brainstem and or spinal cord and or the peripheral nerves that are adversely impacted. And I would tend to agree and maybe add, I would describe 4 parts of a subluxation. The first part is a misalignment. 2 is an occlusion of an opening of the spinal cord or the nerve root. 3 is pressure or torsion or distension uh, of the spinal cord or parts of the spinal cord or the nerve roots that exit the spinal cord. And 4 is interference with the mental impulses going from the brain to whatever cell, tissue, gland, or organ that those nerves go to. So, and it's that interference between the brain and body of the brain that adversely impacts the body. And when that's corrected, it almost sometimes, in some cases, and not in every case, and I would say not in most cases, it almost seems like a flat out miracle because so many different bodily systems are impacted by doing one very scientific, one very specific procedure. So yeah, a subluxation is a bone out of place, or another way to describe an upper cervical subluxation or an atlas subluxation, an atlas being the C1 vertebrae. And I have a model of a C1 and C2 vertebrae above my right shoulder. And that's a model of a C1 and C2 vertebrae. And we talked about the cranial cervical junction. The cranial cervical junction is where the skull, the base of the skull, meets the atlas or C1 bone. And so when that goes off, it actually can adversely impact the vascular system in the brain or the neurologic system in the brain. And so when we talk about a subluxation or the cranial cervical junction, we're talking about brain to body health. We are talking about brain health. And that's been um, that that preposition has been measured in so many different ways over the last 90 years that this work has been around. This work has been around since the early 1930s. And so this is not new, but there's been multiple generations of improvement on this work. And so hopefully the public can take advantage of that. And that's why we're here today describing the uniqueness of this work and the specificity of this work. So with that said, let's go on to the 21st, actually it'd be the 20th symptom. That's the chronic adrenal fatigue that you had shared with me. What percent overall improvement over the last 12 and a half years would you give for the chronic adrenal fatigue, Betsy?
I would say that's also fluctuated. I think it's very much tied to sleep apnea. Uh, mm, I would say like 80%.
80% better. Did you take any drugs for your adrenal fatigue?
Are there drugs for adrenal fatigue?
No, I'm sorry. Did you take any medications for your adrenal fatigue?
Oh, no, no.
Okay,
Uh,
so are you saying that your adrenal fatigue was 80% improved without drugs?
yes.
Okay. And for the viewers, you've taken a lot of drugs. Prednisone was one. I think I listed it, rattle off about five over this viewing. Um, what improvements have the drug therapy, in your particular case, that have helped you?
Oh, not at all. But I would add there I was on Cipro, which is a very bad antibiotic. I mean, it's helpful in some cases, obviously, but it has a black box warning from the FDA. So that's one that you can add that I was on. I was on, yeah, prednisone, Isocol, amitriptyline, Cipro, and a number of other antibiotics at one point, um, and a couple of antidepressants. And so, yeah, what helped is actually nutritional supplements as well as all the other things that I've been doing. So, I was definitely doing some supplements for mitochondrial supports. And of course, those are the energy producers of the cells. And so, I was doing like a combination, like I'm doing right now, of CoQ10 and PQQ for my mitochondrial supports and ashwagandha, number of adaptogens.
Mhm.
So, drugs that zero supplements.
Gotcha.
They win. Yeah.
Because so far, we've got more to cover. We've got about um, 22. Uh, we've got about 27 total symptoms. So are you saying with 27 total symptoms, drug therapy hasn't helped you at all? Hasn't helped you with any of those?
Not for me.
Okay.
Mm-mm.
And that's what we're asking. We're only asking you. We understand that there is a time and place for drugs. I'm sure you were anesthetized when you had some of your procedures done
Mhm.
with your dentist. And I mean, there is definite, I don't think what you're saying that there's never a time or place for drugs. I'm
Mhm.
not hearing you say that. I'm not hearing you say that you're anti-drugs. I'm actually hearing you say that was one of the first things that you did for many of these symptoms. And just for in your particular case, that it didn't work for you. And in some cases, there was actually some very, very severe side effects of the drugs.
Yeah, especially on the microbiome, and I honestly think that the candida might have been a side effect of the prednisone. I don't know, but not for me. And for me, it just isn't natural. It's not logical for me. I want to know, what's out there in nature, like what has God provided for us. And so looking at those things first and foremost, and what is it that we can be on, and that's sustainable. Um, Probably not going to overdo the cucumbers.
Well, that's kind of funny. Yeah, how can you overdo cucumbers? They're pretty delicious. As a matter of fact, I love cucumbers. And you said what's God provided and what's sustainable. That's just so cool that you said that. But with that said, um, uh, I'm representing the Cranial-Cervical Junction Healthcare, in a clinic, and we're not anti-drug. We know there's a time and place for everything in healthcare. That's why they have doctors that do that. But I think what some people are against the overutilization of synthetic petroleum-based medications or drugs, and then taking them for long periods of time and getting maybe very nominal results, if any, or getting side effects, and then not reevaluating. And then when people get a second opinion, sometimes it's by another doctor that exclusively pretty much does drug therapy. So you're getting a second opinion by a drug therapy specialist, and you're not really getting a true second opinion in some cases, not in every case.
Mhm.
And I've seen that over and over again. And in my mind, I'm thinking, well, they went to four different doctors that only do drug therapy, um, although it's very important to have that evaluated for, what about all the other things that you did that weren't evaluated? And why was that the first thing looked at? So again, we're talking about patient health, not physician incomes, um, not pharmacology incomes. We're not talking about dental incomes, dentist incomes. We're not talking about functional chiropractors incomes. We're not talking about general chiropractors incomes. We're not talking about cranial cervical junction chiropractors incomes or any of the other specialists that you talked about. What we're concerned of is the end user. We're concerned for patients and getting good quality healthcare with minimal side effects and maximum side benefits. Um, and I think that's why you agreed to do this interview, didn't you, Betsy?
Oh, absolutely. I mean, this is one of the key things that has helped me the most over all of this time because I really started dealing with health issues back in 2004, 5. So it's really been a long, long time. So I've tried a lot of things, and this would be one of the key things that I would, if I had to start over, and just pick the most important things, this would be number one. This is where I would start.
So when you're talking to the viewers, when you're saying this, what do you mean by this? What is the most important thing? What is the most important place to start?
So yeah, I think structure, just like any house, that you have to have a good foundation. So, so I'm talking about, yeah, a cranial work, the cranial cervical junction work. For me, also the tongue tie was a huge part of that. And actually, when I got the tongue tie release, that destabilized my neck, and so then I really needed more care because it was like I had to figure out where I was in space all over again. The proprioception might have been off or affected by that. Not exactly sure. So that was a thing. The tongue tie release is definitely part of the structure, and the dental work is also really important. But again, it's just, yeah, it's dealing with your foundation, your structure, and the cranial cervical junction is like, it's key right there. It's right around your brainstem. So that's a key place to start.
So are you saying that the that cranial cervical junction is the most important joint in your entire body?
For me, it has been. Yeah.
Well, for you and for everybody else and for the viewers, the most important joint in your entire body is the cranial cervical junction. It's where the bowling ball meets the broomstick. It's the only synovial diarthrodial joint in the body. It's the only vertebra, meaning C1, meaning the atlas or cervical one, that doesn't have a disc adjacent to it, neither above nor below it. It's the only vertebra of the stack of 24 that doesn't have interlocking joints above or below, on the left or the right. It's the most complex systems of fulcrums and levers. Next to the temporomandibular joint, it's got the most nerve fibers and sensory fibers. It's the only vertebrae in the stack of 24 that the muscles are innervated below the level of the spine. So if the atlas goes out of position in relationship to the skull, it doesn't have a means to be self-correcting. So what we're saying, well, I'll put C2 in that category as well, as not having a means of being self-correcting, meaning the upper cervical C1 and C2, the atlas and axis. But the rest of the stack of 22 bones below C1 and C2 don't have a means of being self-correcting, meaning if they get traumatized or damaged due to an injury or fall or some sort of sporting injury, the body has some limited means of being self-correcting. The atlas doesn't have that at all. The average vertebrae has a spider web effect of vertebrae 3 to 5 levels above and 3 to 5 levels below nerves that go to the muscular system, that if one level goes out of position, other levels can neuroadapt to that and either keep it from going out more or self-correct or keep it from getting worse. The atlas doesn't have that. Um, so let's continue. We kind of got a little bit off on a rabbit trail, but I'm glad that you shared for the viewers that you talked about drug therapy and how the drugs didn't help you and actually created side effects, and how the number one biggest thing in your case was dealing with the cranial cervical junction, where the bowling ball meets the broomstick, where the head meets the neck, and that top vertebrae called the atlas. You also talked about you had tongue tie therapy, and you also had interventions in your palate, in your mouth, and other things that have helped you dramatically. And that's great. Thank you for sharing with our viewers. The next one is pelvic issues. What percent overall improvement was the pelvic issues after 12 and a half years?
I'm not sure. I don't seem to have too many issues now, so maybe I could say 80%.
Okay.
Um,
But you don't remember that well, and that's fine. I know 12 and a half years kind of goes by and you kind of forget how bad it
yeah.
was. And then you also mentioned the right and left trapezius muscles, where they're really tight. People just kind of grab their shoulders like that. And you said how the right was worse than the left. What percent overall improvement was that when you're under some level of consistent care?
Oh, well, under care, um, it can be up to 90%, but I haven't been under care for a while, and so that's what we're working on. Yeah.
Okay. And now without care, where is it at?
Uh, Bad. Not in, not improved.
Okay.
It's been pretty bad. Um,
Gotcha.
it goes back to baseline.
So when you're saying when your head and neck are misaligned at that cranial cervical junction, that you could have pulling, that the body is neuroadapting, and the muscles kind of get in spasm, and they kind of be tight on you for no reason. You're not trying to make them tight. Are you saying there's some connection, Betsy?
Yeah, for sure.
Okay, well, fair enough. I think that concludes our comparative clinical case history. I know it's been at least a couple hours since we started. We've been at this, and to every doctor that specializes in the cranial cervical junction, and every general chiropractor, and every therapist that I've talked to, they said that you should only maybe talk about it briefly, like maybe a few minutes or 5 or 10 minutes. But Betsy, for our viewers, how could they really understand the breadth and depth of your condition in 5 to 10 minutes?
No, that's not possible. Yeah. And the thing is, it's just like dominoes, one thing leads to. Actually, it's more like those complicated domino things that you see on YouTube, where there might be one that tips and then everything all different directions goes, where it's not just like this cause this cause this. It can be multiple things at once. So that's where it gets really complicated. And yeah, just going back to at least making sure your head's on straight is a good place to start, because otherwise the whole gut brain, in chronic inflammation, all the things that can go wrong from there. That's a good place to start.
So you're saying when your head and neck are not in the proper position, there's a misalignment there, that can cause a gut and biome adverse health conditions and a brain health condition. Is that
Oh
what
yeah,
you're saying?
yes, I've experienced both of those to the extreme, actually. I mean, to the point I could not tell how far down to step while walking down the stairs. Things like that. I couldn't remember the names of things in the kitchen. I couldn't remember the names of people I was working with. And so, yeah, definitely my brain was affected. and then the gut definitely affected. Everyone that I have gone to has said that I was an extreme or complicated case, whether that's the dentist, the chiropractor, medical doctor, functional medical doctor. They're all like, you're a difficult case. I'm like, I know, thank you.
right?
Um, yeah.
So, and
So
you really are a difficult case. And that's why I didn't think I could have this conversation in 5 to 10 minutes. I mean, what do we talk about? Hey, when your head's on straight, your body works better. End of conversation. But
yeah.
that doesn't really help people understand what's really going on. Just introducing the concept that a head can be misaligned on the neck and that there could be a cranial cervical junction malalignment, and that could create a brain problem, is just to wrap your brain around our audience's brain around that. Isn't that this is what we want to accomplish in this session, Betsy?
Yeah, that's the thing.
I mean,
And
if
then
they haven't comprehended all the other very intricate things that you've done, which I'm still trying to understand. But we really wanted to introduce the viewers to this, didn't we?
Mhm.
Now, Betsy, do I have your permission to use this recording? Um, however, the clinic would like to use the recording.
Oh, yeah, absolutely. Yeah.
Betsy, do I have your permission to um, uh, to share with other people about your case, about these factors that have gotten improved?
Absolutely. Yeah.
But you know, when I do that, Betsy, it makes it sound like I'm making it up because it's impossible. You know how it comes across, right? It comes across like I'm trying to puff myself up, like this is impossible. But what I would challenge people is the best thing is when it comes to healthcare is end outcomes, end results. That's why Betsy is being interviewed, because of her great results. And so I think letting her speak, her words speak for themselves. I think that would be the best way to describe that, not me describing it. But thank you so much for allowing this conversation to happen. You 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 have absolutely fought for your right to get healthy. And how much have you paid for this? You said you saw over 50 specialists. You've been on 5 or 7 different medications, none of them which have helped you. Some of them created side effects. You've
Mhm.
seen a lot about the top 5 or 6 or 7 specialists that have helped you dramatically. You're very thankful for all the physicians and therapists that have helped you along the way. But how much between you and your third party and out of pocket and your insurance companies, about how much do you estimate that you've paid for all this?
Oh, thousands.
If you were to put
Um,
thousands, like 10,000, round it to the nearest 10,000,
well, I mean, if it
50,000, 100,000, 200,000, 300,000, 500,000, a million, 1.5 million, 2 million. I mean, what are we talking about?
oh, I don't know. I mean, I guess when I was under when I was in the hospital for a week or 10 days at a time and, covered by insurance, obviously that was thousands, tens of thousands. And
Probably
then,
closer to hundreds of thousands.
probably,
I
I
mean,
don't,
per day, we're talking what, 5 or 10 grand, or maybe 20 grand a day, 30,
yeah, so
40
then
grand
that
a
makes
day.
a total of like, probably 20 days, hospitalized if I add them all up.
So if it was between 10 and 20 grand a day, let's just average that out. Do you think that would be exaggerating, or what do you
No,
think?
probably not.
So maybe let's just say 15 grand a day times 20 grand times
Yeah, it's
20
hundreds
days
of
times
thousands.
15,000. What does that equal?
Yeah, that's what was that? Were you talking 300,000 or something like that? And then,
So 20
uh,
days times uh,
oh,
if it was 10,000, it'd be
oh,
uh,
15,000 a day.
200,000, or
Yeah,
20 days,
300,000.
400,000. But if it was 5,000, it would be, I guess, be half of that. So
Oh,
that'd be about 600,000 just with hospitalization alone.
oh
So
yeah.
would you say you were approaching 0.7 to 0.9 million dollars that you've got into your case right now?
Uh, I believe it.
Is that an exaggeration, or I mean, it's
It,
probably under 1 million?
hopefully.
And how old are you? Can I ask? Do I dare ask? How
I,
dare I ask? I
I
say.
am 38 at this
Oh
time.
my goodness,
Mhm.
38. Well, those races take off about 25 years, Betsy.
Oh yeah, I guess I'll keep them.
Yeah,
Yeah, so it's
by
hundreds,
all means, you better keep them. I agree.
yeah,
Keep them. Uh,
hundreds of thousands, and yeah, I'm sure it's got to be something like a going on 1 million at least. And then
so,
most of most of what I've done actually, besides the medical, like the conventional in the hospital stuff, has been out of pocket.
mhm.
So
So
yeah.
now I always kind of was curious because I know that in some of these troubling times that you were through, that you could barely work, if work at all, or work for the family logging business, log cabin business, kind of like Little House on the Prairie, but kind of in a cool way.
Mhm.
But you also were doing really unique work, uh, and things maybe just to get you through your depression. And I don't want to say in what those were, but you worked some very humbling jobs that didn't utilize your 2 degrees and your summa cum laude. But some of those jobs you probably learn more than you learn in college.
Oh yes, definitely know how to make espresso drinks.
Well, hey, praise God for the local barista, right?
Yes,
Hey,
yes.
don't
Uh,
forget to tip your local barista generously, correct?
right. Yes. You never know. Yeah. So yeah, coffee shop, health food stores, um, and then writing for natural health websites.
Well, that's
So
just fantastic. I mean, we got to get you contracted with our clinic and get this thing going here. I'm sure you would be great for us and to share the message, that people just absolutely need, Now, we went through the list of, I estimate about 27 symptoms. I don't know exact. I mean, how do you put a number on it?
oh, there were a lot more too.
And there were a lot more that we didn't even discuss, probably
Hmm.
under 50. I mean, I don't know. But you've had 38 years young. You spent going on $1 million. You've seen at least 50 specialists, probably more, and doctors and therapists. Now,
Hmm.
let's change gears a little bit because this is very interesting to me. Um, Before I do, I want to do another intermission, but I want you to talk about injuries. Can you talk about some of those injuries while I make a quick text, please?
Oh, yeah, and what caused all this? I would say it goes back to being born C-section, backwards breech. Um, I've learned from Dr. Phillips that when babies are delivered that way, there tends to be a twisting of the head and neck and spine, and now it's recommended to bring a baby in for a chiropractic adjustments soon after. But I had that right away. And then the tongue tie was missed when I was little. So I just had that done a couple of years ago. But growing up, I just remember in gym class, that was not my forte. And I got hit in the head with a ball a couple times and didn't receive chiropractic care right after that or anything. Um, so I think that would have contributed. Um, I also had an injury. I hurt my toe, my right toe, and so then it I stubbed it somehow like on a rock hiking in sandals, which is not a great idea. But then for a long time, I just favored that or side of my foot, like I try not to step on it, and so then I think that changed my gait. And so then that could have impacted my spine as well because I was not stepping on both feet the same way. Um, those would be some of the major things. And then also with a lot of things, there can emotional trauma can really affect us as well, right? And so that was a thing too that I had when I was only 3. I remember my dad going through cancer treatment. So um, I would say that was another thing that could have thrown me off balance. Um, other than that, as far as injuries, I never broke any bones or fell out of a tree or anything like that. So it was just probably just little things.
Mhm.
Um, can't think of
Yeah,
anything else at the moment. Did I write
okay.
anything down?
Well, that's great. That's great. I've got some other injuries that you shared with me, and paper's cheaper than brains,
Yeah,
right? So we talk about clear back to childhood as far as you can remember. Even from the birth process, and the
yeah,
very first thing that rose a red flag was you were a reverse breech malposition as you described it back in
yep,
2008, and you had
mhm,
a C-section delivery, which can be one of the more dangerous deliveries to the alignment of the head and neck
yeah,
and
mhm,
to brain health. And so you enter this world already a huge disadvantage and a high probability for having a cranial cervical misalignment from birth, creating a brain problem, and you're not even 1 hour old. So that scared me. But then you also shared with me how you had an unanticipated basketball strike you in the head.
yeah. That's it.
And I don't know if that was the same injury that you were just describing now.
I think so. Yeah.
Okay. And then
Mhm.
there was another one where you described a whiplash of your head and neck where you fell backwards when you were roller skating
Oh, I
as a young
forgot about
girl.
that. Yeah. Yep.
Uh-huh.
That's
And
interesting.
then you know, there's probably a whole bunch of other additional injuries. There's actually a medical legal term called mechanism of injury, or MOI, mechanism of injury. The attorneys just love beating this to death, but so do the cranial cervical junction doctors, because if it wasn't for a mechanism of injury, you wouldn't have a cranial cervical junction impairment or misalignment, creating poor brain health. And so I believe that in your particular case, Betsy, that you had this cranial cervical junction impairment and brain neurovascular impairment, possibly from birth. But if it wasn't from birth, at some point when the connective tissue couldn't withstand the trauma or the force of the trauma, the blunt force trauma, and when that connective tissue gives way and breaks down and gets stretched, if not torn, then you have some level of permanency. And we know that 40 to 50% of car accidents lead to some level of permanency, with the soft tissue, the connective tissue, the ligaments, the fascia, the scar tissue, or the torn ligaments, or type 3 collagen fiber, however you want to describe it, or discs. But these factors can get injured if not damaged, or bulge, or abrasions, and to lead to some level of permanency. And I believe that that's you. That describes not only you, it probably describes most of our viewers. They're walking around with a short leg. They're walking around with torn, stretched if not torn connective tissue, with that uh, head and neck buckle out of position, and poor brain health and full body distortion. And they're wondering what could possibly be wrong with me.
Yeah. I was thinking too. Just looking back at childhood photos, and I quite often my head is tilted, always to this direction.
So you
Um,
have right head tilt on a lot of your childhood pictures.
mhm,
Wow,
yeah.
that's interesting.
Yeah, and then another interesting thing is that my aunt had surgery for torticollis when she was just a child,
Mhm.
and that probably could have been prevented with cranial-cervical junction work. Uh, so that tendency toward cervical dystonia is in the family as well. So I don't know, it's kind of interesting anyway that we've both had these these neck issues and a tendency toward these muscle spasms.
Sure.
So
So I'm trying to man the jurisprudence section and the malpractice section of this talk. And so just for the viewers, those were Betsy's words and not mine. And I would agree with her, by the way, that some forms of torticollis are helped or improved or cured or whatever you want to describe it,
Lesson.
with
Yeah.
this cranial cervical junction work. But I would also say that some forms of torticollis are not helped with the cranial cervical junction work. There's a whole bunch of different forms. And I would actually say probably the most scientific thing to do is get under care by a cranial cervical junction doctor first. And if you're one of the ones that are going to be helped with it, well, good. You know that that was probably part of the problem or the primary part of your problem or the exclusive part of your problem. But if you're the ones that did help and you were evaluated for that and it was ruled out that that wasn't the primary cause of the problem, and then to keep searching. But that's kind of how I'd approach that. So that's interesting. So you
Hmm.
said that there was probably one particular damage thing that probably damaged your head and neck and created this misalignment, this subluxation or this cranial cervical junction impairment that created this problem. But then there was these subsequent throughout the rest of your life, these subsequent injuries that probably made it worse over time and damage it further, or maybe
Yeah.
one you got away with. It didn't cause any further damage, but some of the ones actually continue to create further damage, and then you just started to live with it.
I think the tongue tie was a problem too,
Mhm.
possibly contributing to that because I could never, um, like my tongue was low resting in my mouth and was not at the roof of the mouth where it's supposed to be, and that changes things too, how you swallow food and just everything.
Mhm.
So there were a lot of structural things, and then finding out that potentially an MTHFR mutation could have set me up for the um, tongue tie.
Mhm.
So yeah, and the thing is, no matter what, there's not one answer that helps everyone, and for many people, there are multiple things that need to work together. So there's never a cure all. I mean, rarely. It's like a almost cure somewhat, and then you still have to do other things. I just don't know if people can get away with like the unhealthy lifestyle. There's always it's a full body thing, a holistic approach, as
Mhm.
you talk about. But yeah, so whether it's torticollis or anything else.
It's just so interesting. I mean, obviously, this is all right up my alley stuff. I love this stuff. I don't worship this work. I realize that it's the doctor's job to locate, analyze, correct, and monitor the head and neck alignment for the rest of their life in 80% of the cases that I see over the last 15 years. That's what we recommend, lifetime care. For the 20% that don't have a permanent problem, and we see people like that too, that maybe under care just for a few weeks or a few months or 6 months or a year or two. And we see those type of people too. Few visits, few weeks, few months, and they're good to
Yeah.
go.
Mm.
And of course, in those particular cases, like a good dentist that's involved in prevention, we recommend for those people to get checked every 6 months or immediately after an injury. In some cases, uh, before the emergency room. Now, depending on if it's life threatening case, they might need to go to the emergency room first. Okay, but it could be life threatening due to a cranial cervical junction impairment, and so in which case you'd want to call if you have a relationship with your cranial cervical junction doctor and you have their emergency number, well, you can call them before you go to the urgency room or the emergency room, and the doctor can help navigate that with you. And that's having an attorney at your beck and call. That's what you want. You want someone in your corner fighting for your right to get healthy. That's just my humble opinion. Now, there was also some very interesting things as I was reviewing the imaging that was done in our clinic back in 2008. We did about how many I have in front of me here. Um, we did about 4 sets of head and neck imaging over 12 and a half years. Betsy, would you say that we overutilize imaging in our clinic?
Oh, no, I mean, I realize you need it from all different angles to get an accurate adjustment. So, and obviously 4 times over that amount of times, not that much because you're constantly changing, especially now, like getting this stuff done, I will probably need a whole new set because it's not going to look the same as it did before.
Would you actually say that maybe we could have even been more proactive if we had another set or two over the last 12 and a half years, that probably would have not been necessarily utilizing imaging in responsible healthcare practicing?
Yeah, and I know there was a huge a span of time when I didn't come in, and I'm not even sure how many years that was, as I was just dealing with the gastrointestinal issues. But yeah, I think getting knowing where you're at, knowing your baseline is always the scientific way to go, right? So then as you're making changes, check and see, well, how have we done? And so I feel like that's the case no matter what type of doctor that you were to go to, like they would mostly want that, but not this necessarily that's the case. But you would think that's the scientific way to go, right? Is to check your progress along the way.
And one of the interesting things is not only did Betsy have 3-directional head and neck imaging, radiologic imaging, but we also have software that actually measures to the nearest umpth millimeter, nearest, like, I don't know, hundredths of a millimeter, in a whole bunch of different factors. And so it wasn't just that we took the imaging, we actually have measurements on the imaging so we can see how you've neuroadapted over those 12 and a half years. Um, and also, of course, we've also had imaging on your spine too, and your pelvis as well. And so that's very important for making measurements on those and seeing how you're neuroadapting, how that's improving as well. Um, Another thing that you had brought up earlier, Betsy, is the scoliosis in our talk. And I had diagnosed, you said you had diagnosed it when you were really young. And
Middle school.
I don't even know where I wrote it down. And I don't want to speak out of turn or misspeak, but I had written it down somewhere, and I've got it in your file. I guess I'll go to the file here. When in doubt, right? um,
Yeah, I think there was some like a little bit of an S in mid back, and it wasn't extreme or anything, but it was significant.
and when you said it wasn't extreme or anything, and I think now this isn't to call you out on it, Betsy, but I think all of us are minimizers when it comes to healthcare. We're minimizers. Now, Betsy, if you had a son or a daughter or a niece or a nephew, and they had a 15 3/4 degree right convexing scoliosis between T9 and L5, would you think that would be a very minor thing or a very big deal?
Well, coming from a layman's perspective, it sounds like a big deal. But yeah, 15 degrees. I don't really, it's not my area as much, but I would say that it sounds like a lot.
Sure. And I really appreciate that. Now, because, what the viewers heard is, well, I just had a little curve in my back. Well, the viewers know that there's the neck isn't straight up and down. That if you look at it from a side perspective, that there's actually supposed to be a curve in the neck and a
Mhm.
curve between the shoulder blades going backwards and the neck going forward and in the shoulder blades going backwards. And then in the lower back, it also goes forward again. And so when you look at it from the side perspective, you actually want to have those curves which cause the body to have shock absorbers. Now, conversely, when you're looking at the body, the head and the skeleton from the front, generally, if you're built straight, you generally want the body to be symmetrical from side to side and the spine generally straight when you're looking at it from the frontal perspective. Now, when we look at your spine from the frontal perspective, you have a 15 3/4 right convexing scoliosis. And so that it would be significant. And in your particular case, I would say imaging has been underutilized in your case because your doctor should have had imaging on your full spine, meaning the top of your head to the bottom of your pelvis and everything in between, one from the front and one from the side perspective every 12 months over the
Oh,
last 12 and a half years.
oh, okay.
So we'll make sure not to make that mistake next year.
Yeah,
We
okay.
wouldn't want to do that to you. But my question is how much has it improved? And it probably would have improved, but now with the gaps of care, there's been some significant gaps in care. This last significant gap of care was 18 months. That's why I would try to encourage you to consider this particular technique and this particular doctor um, for the rest of your life, just to contract him. I know it sounds really self-serving when I say it, but I'm saying it to the world. Um, and one of the reasons I'm saying that, I just almost feel really self-serving saying that, is it's just been very painful listening to your experience, Betsy. I mean, to the viewers, I can't imagine what they're thinking. This poor female, what she's gone through. Now, one of the reasons I say that is because of of your atlas bone. Your atlas bone looks kind of like this here.
Mhm.
That's the atlas bone. That would be from a top perspective. And where my ear is, that's the front.
Mhm.
And so that's what an atlas looks like. These tips right here, these tips right here are called the atlas transverse process. Okay. And these are right behind your ear. And you have a part of your skull that sticks down on the side of your ear called the mastoid process. And the mastoid process,
Hmm.
oh, cool. Turn that thing up. Oh. Do you have a pen so you can point with a pen? Can you point to the mastoid process?
What's that?
Okay, that would be part of the mandible.
Oh,
Um,
the
um,
the little spiky thing.
okay, that's the styloid process. Go back one more.
This one?
Yep, that's the mastoid process right there. Now hold the head up normally. There you go. Now point to it with your pencil. That's it right there. That's the mastoid process. So the reason I'm saying that, and if you want to set it down for a minute, but keep that at the position of ready.
Okay.
So the mastoid process is in very close proximity to the transverse process of the atlas C1 vertebrae. So
Mhm.
much so that it's actually tucked behind it. So much so that if you're doing a transverse contact correction, that you can't contact the transverse process with a hand.
Yeah.
That's the problem. So what I am saying is you're getting an instrument adjusting, a table mounted $26,000 instrument that doesn't that is sitting behind your ear and transfers the force about 3/4 of an inch. Okay. And it's that force that transfers actually shifts the vertebrae into position. Okay. And what I'm saying is um, the stylus can be between the ramus of the jaw and the mastoid process of the skull. And it can lead it. So I can actually be above the very bottom or inferior most point of the mastoid process because I'm between the mastoid process and the ramus of the jaw. I'm between those two structures and I can lead it. So the tip of the mastoid might be right here where the transverse process is, but because I'm leading it, I can get to it. But if it's a hand cranial-cervical junction technique or procedure, it's going to be very hard to get on the top part of the transverse process, which is actually where you need to get to with the hand. If you're getting to the bottom part, what you may do is if you're laying on your side like this and it's high on the top where they're contacting, they might get to the bottom of it, but they're certainly not going to get to the top of it because it's impossible. And then they might actually make it go the wrong direction. Instead of making it more level, they might actually push it so it's more unlevel if they're upright. You see what I'm saying? So of course the correction is made when you're laying on your side. So that's kind of what I'm saying is you need the thing that helped you is atlas orthogonal cranial cervical junction procedures. That's what helped you. That's the technique and the protocol that helped you. And that's the kind of doctor that you need. At least that's what I think. But I think it's because it's the anatomical, the average case is the transverse process tips sit 8 millimeters below the inferior-most tip of the mastoid process. So you can contact it with your hand. And especially if you have small hands like myself, you can contact it with the fleshy pisiform right here. You can contact it. But what if it's inside of those 7 to 8 millimeters of the inferior-most tip of the mastoid process? Then you have big problems contacting it. So there's more than one approaches to correcting the atlas, and sometimes just based on anatomy, one approach might work better than others. But that's actually the scientific explanation why I think the atlas orthogonal adjusting procedures or cranial cervical junction procedures or program in your particular case is a superior program than any other program. But you did say that that the NUCA program also did help you. And so we definitely want to acknowledge that. Mm-hmm. I've also got a picture here for our viewers. Mm-hmm. And this is the head and neck distortion. So I'm peeking around the corner here. That's that full body distortion. Okay.
Yep.
That's the full body distortion that you were talking about, Betsy. We kind of beat that up. The reality is most people that come in have this. And you see right where my finger's at right here? Mm-hmm. Most people actually have that. Where those three arrows are at right there, where those three arrows are at, that represents the lower part of the brainstem that the atlas protects, just below the base of the skull. There's an estimated 10 to 14 trillion nerve fibers that go through that brainstem right there. And depending on how the atlas is subluxated in relationship to the base of the skull or misaligned will depend on what area of those 10 to 14 trillion nerve fibers that are affected, what nerves that are affected. And depending on what nerves are affected will depend on what organ systems, glands, cell, tissue, and organs that are affected. So hopefully that helps a lot. Mm-hmm. Another factor is it's kind of the exception and not the rule. The exception that most people have this problem And so, the first question is, have you been told that you have a short leg?
Yeah.
A lot of people have heard that. Some people
Hmm.
from their medical doctor or physical therapist or maybe chiropractor, or maybe a tailor fitted them
Yeah.
for clothing and one hip was higher than the other. Or like you, Betsy, you talked about how you got right head tilt in your childhood pictures. And we talked about the high shoulder and people that have that. Or what about going mall walking in winter in the state of Minnesota? Going mall walking? For the people that live down south, they don't know what that is. Explain for the viewers what mall walking is and when you do it.
Oh yes. When there's plenty of snow out there and ice and you don't want to fall and create a subluxation, you go to the mall and you go just power walking around the mall.
Sweet. And we got the Mall of America. We think it's the coolest thing in the world. Well, it's a tourist trap, but it's pretty cool for the people that like that sort of thing. And there's 4 different floors they can walk on. Now, believe it or not, a lot of the mall walkers are older people, a lot of times senior citizens, people that the mall is unlocked, but it's not really open for business. You can walk around the mall, but the stores are closed. Maybe Caribou Coffee is open, stuff like that. And so, believe it or not, there's a lot of elderly people walking around the mall. And um, I would even say they're not walking around the mall, they're schlepping around the mall because their gait is impaired, because they've
Mhm.
been walking around with a full body distortion due to a neurovascular condition created by a head and neck that are misaligned. And they're schlepping, they've got the gait. I mean, I don't want to recreate it for you on this video. I'm sitting down right now, but it's pretty disgusting to watch it. It's pretty disgusting. Now, I'm not going to protest. There's a lot of people in the Twin Cities protesting these days about everything, Betsy, isn't it?
Yeah.
Burning down the city, right?
Uh-huh.
But what's that going to help? Because we could do a silent protest and not have done this conversation, taken the time out of this Sunday, or we could have shared with the people what they really need to do for their health.
Mhm.
So is there any other anything else you want to get off your shoulders, Betsy?
Off my shoulders, huh? It's like connection. Let's see here.
No pun intended.
Yeah, no pun intended. Um, yeah, I mean, I just think that for health, it's important to start with the simplest things. So like removing, what could be causing problems. So, if there's say, yeah, the subluxation or in the spine, you have to just remove it, before you add a bunch of things. And that's, whether it's removing stress or removing toxins. And so that's why this makes so much sense is you're keeping yourself from like getting in your own way, basically, so that's where, yeah, it makes so much sense. You start with the basics, like, are you drinking pure water? How is your foundation? Are you able to breathe properly? The sleep apnea thing. Are you sleeping? So it sounds like health has to be so complicated, but in some ways it isn't at all. You're just going back to the basics, and that's where, yeah, foundation, cranial, cervical junction, and keeping, not getting in the way of your own healing. So that's, I guess, that's my little spiel on that.
Wow. Well, it just means a lot that you would take the time. It tells me that you care about humanity. You care about other people sick and struggling. This could be you watching this video on YouTube in the middle of the night, sick and struggling, just wondering what to do. Maybe you felt like you haven't been heard by your physician, or maybe you feel like they're just you've tried everything and nothing can be done, or maybe just given up. You know, but I would encourage you not to give up. That you're worth it. That you can do it. that if you might play a part, there might be some part that you have to do. You might even have to reach into your pocketbook. Some of these things may not be reimbursed by your insurance company. You may have to drive a long ways to procure the care that you need. And there could be a whole host of other barriers or distractions from getting what you actually need for healthcare. But in my humble opinion, you're worth it. This is for you. This is for you to get what you need to get better. Um, you know, not getting better is an option. Not doing nothing about it is an option. Um, Doing nothing about it has always been an option. It's the biggest cop out there is. And so I would just say no to cop outs. I would say yes to health. I would say yes to life. I would say yes to neurologic structure, function, healthcare. I would say yes to people like the Betsy's of this world that have fought, struggled, and clawed their way back to more normal health. When the traditional system perhaps wasn't the answer in her particular case, that she used all her summa cum laude creativity and thought, and she used her brain for more than a hat rack. And she actually took the general contractor's role right out of the doctor's hands and managed her case. She self-managed her case. And she brought in subcontractors, people like me and others. And I'm hoping that the cranial-cervical junction contractors or subcontractors can earn the right of the public, as they have been doing for over 90 years, since the early 1930s. They can develop their systems. I'm hoping, as we look forward to the future, I have a lot of hopes, Betsy, and I've got an ending question for you, but I'm going to kind of make my conclusions, but then I'm going to actually ask you for one last statement from you before we part company. So I'm going to agree with the godfather of the cranial cervical health, who I stand on their shoulders. These are giants. These are Dr. B.J. Palmer. These are Dr. Bill Blair, Dr. Grostick. These are Dr. Sweat, Dr. Forrest, Dr. Stan Pierce, all cranial cervical junction doctors. The late Dr. E.A. Addington III, Dr. Tom Forrest out of Pleasanton, California, next to San Francisco, Dr. Drew Hall out of LA, to name a few. We have Dr. Jeremiah Birch in Sauk Rapids, Minnesota, adjacent to St. Cloud, who does the knee chest work. We have other cranial cervical junction doctors that have put in their time. We have Dr. Kevin Berg. We have Dr. Justin Haney. We have Dr. Carrie Johnson. And we have a whole host of others. As we look at the past in the cranial cervical junction forward to today, I say yes. Evolve, get smarter, better, faster, more creative. Learn to mitigate risk when you can. Figure out new ways to win. Attack your counterpart using new information and intelligence. Infiltrate your competitor and turn him against himself. Adapt and overcome changing competitor tactics. By all means, evolve and get better every day, every chance you get. But don't forget the nature of the cranial-cervical junction. Don't forget the atlas. We must train brutally and without mercy so we can deliver the cranial-cervical junction care brutally and without mercy, effectively and very precisely and specifically. Our job is to close with and destroy our competitor, and we do it better than anyone when it comes to the cranial-cervical junction. Yes, our current season has ended, but the cranial-cervical junction healthcare and brain health endures. Before man was, the cranial-cervical junction and brain health waited for him. As long as man is, the cranial-cervical junction brain health will always be, always. And our great nation will always need us. We'll always need cranial-cervical junction doctors to do what is in our nature. This season, we sought to dominate our competition. Dominate him when he sleeps, dominate him when he plots, dominate him when he hides, dominate him in the adjustatorium. That is our nature. That was our season. That is our duty. Now, as we walk away from this conversation, and we might not meet you again. This might be our last time. But I will never forget the Betsy's of this world, your hard work, your dedication, and your discipline. I will never forget my fellow healthcare sufferer. I will never forget the big, tough cranial-cervical junction doctors, hardcore atlas adjusters that came before me and that taught me the true way of the cranial-cervical junction procedures. And that's about all I have to say about that.
Yes, good stuff.
So,
yeah.
So thank you, Betsy. Again, I want to thank you for your time. We've got probably about 3.5 hours into it. And this is by far almost twice as long as our longest one was 2 hours. But, this is more than a 5 to 10 minute case. This deserves 3 hours, probably deserves 30 hours, to be truthful with you. So we probably were the ultimate in a minimizer. We probably should have done 30 hours. What were we thinking? We only did 3.5. Come on now. We should start trying. We should take this stuff seriously. But I thought,
all-nighter.
Yeah. How many people have been up all night or couldn't sleep like you because of their brain problem, you know? And so I thought, hey, this is worth it. So it leaves me with the last question for you, Betsy.
Okay.
Betsy,
Hmm.
what is the truth about the cervical cranial junction procedures?
What's the truth about it? Um, I think, I mean, it's the place to start. You know, it's just like the reason it's called the Atlas. It's holding up your whole world, right? So, just like Atlas, the Greek mythological figure, right? Holding up the world, and that's why this first uh, uh, vertebrae is called the Atlas. It's literally holding up your world. So it's a key place to start if you're dealing with brain issues. And also brain is, you know, command central. So if anything is going on in the body, the brain really needs to be optimized. And so the truth about the cranial-cervical junction is that it is the place to start, as long as you know that yeah, you're dealing with gut brain issues, which now, I mean, what health issues don't have a gut brain component to them, really? You know, autoimmune disease, that's immune system, that's gut. You know, cancer, that's immune system, that's also gut. It's everything is so interconnected, and not to say there's one answer for everyone. It's just it is a place to start. So that is that's what I would say is that the truth about the cranial-cervical junction, it is a place to start.
Wow. Well, we appreciate that. And again, to our viewers out there, we wish you the very best. This is Betsy and Dr. Schroeder, and we are out.